I'll run through a few opening statements so we all understand how this process will work, but as I do so, we've got a lot of people to testify, and I'll talk a little bit more about that. But the first people on the list, in the order in which they have signed up, is I'm going to list the first three, and if you can kind of make your way down, we're going to have folks testify from this podium here to my left, your right, and that's where the testimony will come from. So the first three would be Robin Adkins, Thomas Hill, Marissa Jensen. So if you can kind of be making your way down here, and I'll try and give everybody a heads up when your opportunity is to testify so we can get down here and get as much testimony in as quickly as possible, with that, making sure that everybody has the opportunity to say everything they need to say. Today we're going to be discussing a very difficult issue, and I understand there's a lot of passion on both sides. As the chair of the committee, it's my job to maintain the decorum in this chamber as we hear from you. And we have a lot of people here to testify, and we want to hear from as many people as possible. To that end, I want to remind you that the long-standing rules of this committee and all committees here in the Senate, then we'll ask you to adhere to those rules and those protocols. The gallery in the room must remain quiet. Accordingly, there should be no applause, booing, audible talking or chanting, because we want everybody to have their opportunity to be heard. I also ask you not to display signs as it impedes the view of those who might be around you. I'm going to thank you also for those watching online. If you signed up, if you signed up online to testify but have not checked in with a person outside the chamber, you must do so in order for us to mark you here. If anyone brought written testimony today, you can drop that off at the desk outside of the chamber in the testimony drop-off basket, and we're also accepting testimony, written testimony, via email until 8:00 p.m. tonight. You can email that to sb1@iga.in.gov. That's sb1@iga.in.gov. Please submit it today so that it can be provided to the committee members before the start of the meeting tomorrow. Anyone wishing to testify should have signed up online on the Senate Rules Committee webpage or at the desk outside of the Senate chamber. If you signed up to testify online, make sure you have checked in at the desk outside the chamber so that we know that you are here. If you signed up in person, we know you're here and we have you on the list. I'll be calling witnesses up to testify off the list, and due to the large number of people we have signed up, I'll ask witnesses to keep their comments to 3 minutes, but you're not required to take the full 3 minutes. As chair, I may expand that occasionally as needed. And I would ask that if you are with a group and or if you have someone that testified before you that you completely agree with, it's okay to say, I agree with that person, that's what I wanted to say. And you certainly have 3 minutes, but if you, we want to make sure to get as many people in to testify as possible. As I think you probably all know, we'll testify and have committee until 5 o'clock today. We'll resume tomorrow at 9 o'clock and go till noon for that testimony. With that, we are ready to begin, but what I want to do first is ask the committee members to introduce themselves. Senator Messmer, would you start, please?
Senator Mark Messmer, Senate District 48, and covers all of 6 counties in southwestern Indiana.
Senator Bassler.
Eric Bassler, Senate District 39.
Sue Blick, District 13. LaGrange, Steuben, Noble, and part of DeKalb counties.
Mike Kreider, represented Senate District 28.
Ted Charbonneau, State Senator, Senate District 5. I represent all or parts of Porter County, LaPorte County, Jasper County, Pulaski County, and Stark County.
Senator Yoder.
Senator Shelley Yoder, I represent Senate District 40, which is Monroe County.
Senator Eddie Melton, representing Senate District 3, which is Gary, Maryville, Hobart, Crown Point, Lake Station, New Chicago.
Senator Greg Taylor, Indianapolis, Indiana, representing Senate District 33.
Senator Tim Lannon, representing Senate District 25, parts of Madison and Delaware County.
Senator Holdman, District 19, Northeast Indiana.
Senator Dennis Cruz, Senate District 14, Northeast Indiana, parts of Allen and DeKalb counties, where Auburn and Fort Wayne are the county seats.
Okay, thank you, members of the committee. Let's go ahead and we'll have Senator Glick present the bill.
Thank you, Mr. Chairman, members of the committee. This is Senate Bill 1. For the special session, the bill prohibits abortion unless the abortion is necessary to prevent substantial permanent impairment of the life of the mother or the pregnancy was the result of rape, incest. It specifies other requirements for performing an abortion. Being about pro-life is not about criminalizing women. It's about preserving the dignity of life and helping mothers bring happy and healthy babies into the world. Many in the pro-life movement have long believed in exceptions to abortion restrictions for the life of the mother, and that exception is included in Senate Bill 1. In addition, we recognize there are heartbreaking cases where, because of violence committed against women and young girls, providing some additional exceptions is necessary. That's why the legislation we are introducing also provides exceptions in the cases of rape and incest, which I believe a majority of Hoosiers support. We want to be very clear about what the bill does not do. This bill does not affect access to the morning after pill, also known as Plan B, or any other method of birth control. It does not affect treatment of miscarriages. It does not affect treatment of ectopic pregnancies. It does not affect in vitro fertilization procedures. It does not prohibit ending a pregnancy when the unborn child would not be able to survive due to the fatal fetal anomaly, and it does not criminalize women seeking an abortion. There are provisions in the bill for criminal penalties. Those will be gone over later.
Thank you, Senator Glick. Do members of the committee have any questions for Senator Glick? Senator Yoder?
Thank you, Senator Bray. Senator Glick, I was curious, current law does allow legal abortion when the physician determines that an abortion is necessary to prevent a substantial permanent impairment of the life or physical health of a pregnant woman. The language currently does not include physical health of the mother as an exception. Why change the current law?
There's been an effort by a number of people to tighten up that exception, and they believe that life of the mother could include physical health or extreme mental health situations. However, that is a subject that has to be determined by the situation at hand, and we're trying to avoid a broad legislative definition. So it's not acceptable at this point in time. It's under debate. Obviously, we're going to hear a lot of debate today.
So physical health is no longer
not just physical health. Right. It's life of the mother.
Thank you.
Further questions of the committee? Senator Taylor?
Thank you, Mr. Chairman, and thank you, Senator Glick, for agreeing to answer a couple questions for me. Senator Glick, right now, all I have in front of me is the proposed bill. So forgive me if I state something that you believe you have a solution for. But the bill as written, does it allow for late-term abortions?
Late-term abortions?
Yes. Would you like a hypothetical?
The life of the mother would include late-term abortions. I mean, that's a determination to be made in the extremis, the situation involving the patient.
Well, my perusal, and again, if I'm wrong, please correct me, but it also has exceptions for rape and incest. So in my hypothetical, if a woman who was 6 months pregnant went to her doctor for her second trimester visit and said to her doctor that the baby that she was carrying was a result of rape or incest, would this bill allow her to sign an affidavit and that child to be aborted?
Not as, well, that is a subject of much debate right now, and I believe it'll be debated here is whether or not she should have acted sooner rather than later. The language in the bill still contains for the, if a baby is viable, if it's 20 weeks, then there has to be a second physician in the delivery theater, for the delivery of the child, to take care of the child only.
Well,
Because the principal physician is taking care of the mother, the second physician is there to take care of the child. So I think what you're approaching is the idea of that baby, if it's a late-term abortion, that baby would be taken care of.
no, let me make it clear.
I'm sorry.
The legislation reads as follows, that there will be 3 exceptions for abortion. Otherwise, abortion would be illegal. And let me read the language because I was a little confused myself, and it could have been an oversight on your part, but as the author of the bill, it says that in the case of rape or incest, that the woman could actually sign an affidavit in order to comply with the abortion. And all I'm asking you is if the woman waits until 6 months to actually say, I was a victim of rape and this child is a product of that rape, could she receive an abortion?
I don't think she could. I think there is going to be, I think there's going to be amendments offered to tighten up those restrictions, because a person, if their sole reason for the abortion is because of a rape, they knew there was a rape early on,
right,
and they knew that they were pregnant much quicker than a late-term abortion.
Right, but you do agree that language, there's no language that I see, and if you could point me to it, I would love for you to point me to it.
No, I think there will be amendments offered. No, I think there will be, Senator Taylor. I understand the language as it sits right now, but we do anticipate language being offered to tighten up that very issue.
Yes, sorry. And then I'd like to talk to you about a thing called let's say, is there any exception for topical pregnancies or tubal pregnancies?
Yes, those are, we define that those are not pregnancies as such. Those are, pregnancy occurs when the embryo attaches to the uterus. Mm-hmm. If it's ectopic, it is not attached to the uterus.
Oh, okay.
So by definition, it's not, it's not attached. It's not a uterine pregnancy at that point.
Yes, and I just want to leave you with this last question. So your definition of pregnancy, just so I understand, is that when the uterus attaches to the sperm attaches to the cervix, or forgive me?
The uterus.
Uterus.
Senator Taylor, if I could, I'll just reading the bill. It says the fetus implanted in the uterus.
Okay, just wanted to make sure that was the definition of pregnancy.
It's section 4 on page 2, lines 21, 22, 23. That language is specifically set forth in the bill.
Duly noted. Thank you.
Thank you.
Senator Lennon.
Thank you, Mr. Chair. Senator Glick, I just want to sort of go back to the basics of where we are with this bill and how we got here. Prior to the most recent, or the more recent decision of the Supreme Court, abortion rights had been determined by the case of Roe v. Wade. Is that correct?
Yes.
And underneath Roe v. Wade, which was applicable in Indiana, the decision to have an abortion was up to the pregnant woman. Is that correct? At least up to the point of viability of the fetus. Is that a broad statement, but a fair broad statement?
It was determined by the federal courts, not left to the states. And the Dobbs decision said it was not a federal issue. It was remanded back to the states for decision. That's why we're here.
But would you agree with me that prior to the Dobbs decision, the choice of whether to terminate the pregnancy to have an abortion was belonged to the woman who was pregnant? Is that correct? Underneath the restrictions of Roe v. Wade as far as the viability of the fetus. it was a personal decision to be made by a woman. You'd agree with that, would you not?
Yes, and some states were more lenient than others. Some states had more restrictions than others, yes.
Right, but basically, unless the Supreme Court had ruled that you couldn't unduly burdensome the choice of a mother to make that decision, of a woman to make that decision, correct?
I believe
That was
that's
the
correct.
standard.
Yep.
And of course, as you rightfully note here, the Dobbs decision then reverted that back to the states to decide, and so now we're deciding, is that correct?
Correct.
And we're going to take away in this legislation the right of a woman to make that decision as to what to do with her pregnancy up to the point of viability. She will not have that decision. We're going to instead legislate what that decision is. Is that a fair reading of this?
I think we're going to put parameters in place, and we, in your scenario, the decision was made by only one party to that abortion. Your decision was that, or your statement was that only the woman could determine.
That's right, the woman who was pregnant and whose body was being affected and whose health was being affected, is that correct?
And there is a concern that the state has an obligation also to the fetus and to the state as a whole, so.
And so the state's going to make that decision for the woman in this piece of legislation.
The state can put guidelines in place, as we have, for the common good.
So do you agree that in this legislation, we are legislating the choice of individuals? They will not have a choice because we're going to make the choice for them in terms of whether they can, they decide whether to go on with the pregnancy or not. They cannot unless it falls within one of the exceptions as outlined within this bill. Is that correct?
Even under Roe, not everybody could get an abortion under any terms at any time.
No, I understand that. I've talked about the viability of the fetus, but up to that point in time, that was a personal, private decision by the woman. Is that correct?
Depending on what state you were in.
And for 50 years, that was the law in the United States, including the state of Indiana.
And it has been challenged repeatedly, year after year, session after session. You've been here a long time. You understand.
Well, I've lived through all this. For 50 years, this was the right of a woman to make a determination as to her own health and her own pregnancy. And the Supreme Court, 5 people, took that right away from women. And here in Indiana, we're going to legislate and take that right away from women in this state. Thank you. I have no further questions. Thank you very much.
Are there further questions from the committee? Senator Melton.
Thank you, Mr. Chair. Thank you, Senator Glick. Just a couple of questions. In your opening comments you made, you discussed life of the mother. This kind of dovetails with what Senator Yoder was asking you in the synopsis, and just want to get straight to the point. It says, prohibits abortion unless the abortion is necessary to prevent a substantial permanent impairment of the life of the mother. Can we get a little bit of clarity?
I'm just sorry I didn't get all that, Senator Melton.
Can we get your explanation or definition to really expound upon the life of the mother? What does that specifically mean to you according to this specific legislation?
I think the life of the mother is a determination to be made in the course of the treatment of that individual patient, and it's within the parameters of the medical care provider and the individual. Given the circumstances, because of the circumstances, it can be a number of different levels, and the severity, obviously, the more closely it approaches a life and death decision, that's the decision that has to be made.
Would any pre-existing health conditions matter in that moment?
Certainly, that is all part of the lady's chart. That's all part of the determination. You can't make these decisions in a vacuum. It has to be determined by the life of the mother.
But the doctor will make that decision.
And the doctor would weigh that decision, of course.
My next question, during the previous sessions, we addressed a lot of things dealing with the pandemic, and we made some exceptions on some of the rules that the governor can make and the state legislature can make around the religious entities in the state of Indiana. Remember opening up churches during the pandemic and things of that nature. I was curious if a pregnant woman was in a predicament where she had to seek a possible abortion and she sought advice from her religious leader, and they too just made a decision collectively that this may be the best to move forward for her life or the life of the child, and she makes that decision, who will be responsible if she decides to move forward with an abortion?
The abortion provider and the mother will make the decision, the physician that's treating the mother.
So,
And I'm assuming almost all women would consult with more than, I mean, that's a very crucial decision if they have time. I mean, you know, some of these emergencies are so immediate, and the extremist situation, it has to be an on-the-spot decision.
so she received advice from her spiritual leader to make the best decision at that moment in time?
No one in this bill is forced to have an abortion. No one is forced to have an abortion under this bill. It's not a compulsory abortion bill.
So her decision is with her.
Her decision is with her. And people choose not to take treatment all the time. That's a decision that they make. People who are undergoing cancer treatment, people who are undergoing, you know, operations, and they decline to go further with treatments, and they choose whatever alternative, but they make the choice. So.
Senator Melton, do you have additional questions? Okay. Are there any additional questions? Senator Yoder?
Thank you so much, Mr. Chairman. I wanted to just ask, or actually I wanted to clarify something, Senator Glick. I don't know about you, but I personally have had so many conversations with women, and I think for a couple of reasons. One, misogyny, and the other is because we do such a poor job of sex education in this state, as well as how we have not taught consent in this state and what that means. I've had so many conversations with women and girls who didn't know that it was rape, didn't know that that's what had happened to them. So to say that at 6 months of the conversation, to say, oh, you know, a person knows when they're raped, I just wanted to say, that's actually not true. And I think that point needed to be clarified, that a girl or a woman may not know that she was raped because the vocabulary or the understanding of what occurred may not even be within the realm of understanding for that individual. So I just wanted to clarify. And also, one question. So am I correct that this bill, because we did hear you say that the bill does not criminalize physicians, but am I correct that this bill expands the definition of feticide to apply to non-physicians who perform an abortion that a pregnant woman requested? Because I know that the Indiana Court of Appeals has held that our current feticide only applies to third parties who terminate pregnancies using violence against an expectant mothers. So it does sound like we are expanding criminalization for providers.
I think this is a framework, this bill is a framework. I think it's going to be subject to amendment in several issues. One of the criticisms of the bill has been the lack of criminal penalties, and so I think you're going to see amendments in regard to that. We're not here to we're here to listen to that testimony and hear what those ideas and thoughts are, and I think we'll be doing that this afternoon and tomorrow. But I agree that those issues have to be discussed and they have to be thought out by the committee itself.
Senator Yoder, are you referring to the language in the bill on page 13 and 14? Would it be okay if I have Mr. Hedges kind of explain that particular section of the bill for you and for all of us? I think it would be helpful.
Thank you. If you look in the bill...
Please get to the microphone, or you can speak from here.
Okay. This is on, so I'll just crouch down a little bit. If you look in the bill, it starts on the bottom of page 13, line 39. It says this section does not apply to, and then it includes 3 groups of people. If you go on to line 14, starting on line 2, it says it does not apply to a physician licensed under 22.5 who, upon the request of a pregnant woman, performs a medical procedure to terminate her pregnancy, even if the procedure is not authorized under 1634(2)(1. So in that case, it's excluding the physician from the crime of feticide.
Senator Taylor?
Thank you. Can I ask Andy a question?
Sure, of course.
Okay, so, Mr. Hedges, so if you look at the first two, it says the pregnant mother does not apply, and the person who in good faith provides medical treatment to a pregnant woman that results in an accidental or unintentional terminal pregnancy does not apply, correct?
Yes.
Now, you specifically say that licensed physicians do not apply. Senator Yoder's question was about lay individuals.
Oh, I'm sorry. I thought she was asking about physicians.
Okay, I just wanted to make sure that the question was clear. She was talking about criminalizing physicians. It does criminalize lay individuals, but not physicians.
That's correct.
Okay, all right. That's what she was saying, I believe. Thank you.
Are there any additional questions from the committee? Okay, thank you. The chair seeing none, we'll go ahead and get to testimony and call Robin Atkins.
Thank you, Chairman Bray and members of the committee. My name is Robin Atkins. I'm testifying in opposition of Senate Bill 1. I am a survivor of child sexual abuse, a rape at the age of 15 and a rape at age 17. I have been pregnant 6 times, one of those pregnancies ending in abortion, 1 in miscarriage, 4 resulting in live births. One of my pregnancies was a high-risk pregnancy that was very traumatic and resulted in an emergency C-section at 32 weeks and a month-long NICU stay. I am also a professional licensed mental health counselor specializing in reproductive mental health. The topics of abortion, pregnancy, and rape are extremely important to me personally and professionally. There's a lot of misinformation regarding abortion and rape. I appreciate the opportunity to provide research and experience to you. How we speak about the topics of pregnancy, abortion, rape, and trauma matters. You will be hearing testimony from women and men on both sides of the abortion debate about their experiences. Their experiences are valid and worthy of your time and attention. They will reveal many complicated issues we face in society that must be addressed. It is not helpful to put narratives upon others, and it's not our job to determine, presume, or create a narrative about how a woman feels about her experiences. Rape is always a traumatic event. It may or may not rise to the level of meeting standards of clinical diagnosis for a mental health complication. Much of that depends on the multifaceted factors involved in the survivor's life, including resilience, social support, pre-existing physical or medical conditions, previous trauma, law enforcement response, and access to resources. Treatment for the trauma of rape depends on the level of clinical symptoms a survivor may experience and can include such evidence-based therapeutic modalities as trauma-focused cognitive behavioral therapy, EMDR, prolonged exposure therapy, and psychodynamic therapy. Abortion is not a treatment for rape. It isn't even a theoretical treatment for rape. Abortion has no impact on rape, as it doesn't prevent rape nor treat rape-related trauma. Abortion does not impact the rapist other than potentially removing evidence of the crime. In fact, abortion is used by sex traffickers and rapists to cover up crimes. Pregnancy may be traumatic for many reasons. Tachyphobia, a fear of pregnancy, is one such reason and occurs in 14% of pregnancies. High-risk pregnancies, such as a diagnosis of hyperemesis, which is what I experienced, may be traumatic and an increased risk of suicide or termination of pregnancy if not treated with evidence-based and trauma-informed care. A diagnosis of fetal anomaly may result in trauma for the family of the preborn patient.
30 seconds, Ms. Atkins.
Patients often report that in both cases of high-risk pregnancy and fetal anomaly, the way they are treated by medical staff and support systems has more to do with trauma than the events themselves. Pregnancy following a rape may or may not be experienced as trauma. Anywhere from 50 to 80% of women who become pregnant after rape choose to carry their child to term, and those who terminate, up to 80%, regret it. Those who carry pregnancies to term often report the perspective of feeling renewed sense of self-control of their bodies, a purpose greater than the trauma from the rape, and a chance to protect the second victim of the rape, the child that did not ask to be conceived in violence or force. Here in Indiana, rape is a level 3 felony, where the rapist may only receive 3 years if convicted, yet the preborn child gets the death penalty. That doesn't seem like justice to me. I'm happy to answer any questions you may have.
Thank you, Ms. Atkins. Let me just say for the public and for you, Ms. Atkins, I don't relish the idea of cutting it short, but if we do 3 minutes today, we'll have 80 people get the opportunity to testify, and so we still won't get everybody in to testify. We just want to get as many as we can. So I apologize for that, and thanks for being here. Are there members of the committee that may have questions for Ms. Atkins? Okay, thank you very much.
May I leave? I brought the testimony for you all.
Sure, if you want to, we have, Ross, will you grab that or you hand it to?
Thank you.
Yeah, thank you very much. Next, we'll have Mr. Thomas Hill testify, and then the next after that is Marissa Jensen, and I would also then ask that Dr. Ott be up after Ms. Jensen. So Dr. Ott, if you're here, please move toward the front. Go ahead, young man.
Chairman Bray and members of the Rules Committee, first of all, thank you for allowing me to testify today. My name is Thomas Hill. I am a senior in high school and president of Homestead High School Students for Life in Fort Wayne. I will be testifying in opposition to SB1. Today, I know you'll hear many deeply personal testimonies. Mine will be a little different. I simply ask that you consider the dangers of chemical abortion, something that SB1 fails to adequately address. In a chemical abortion, a woman is administered a mifepristone pill that blocks the production of progesterone, weakening the lining of the uterus and denying the baby nutrients needed to survive. This violently starves the baby to death. 24 to 48 hours later, the woman takes a second pill, this one misoprostol, that causes heavy cramps and contractions to force the dead child out of the uterus. While at home, the woman then expels and must dispose of the child. She may even have the traumatic experience of seeing her developing preborn child in the pregnancy sac. After the procedure, heavy bleeding lasts 9 to 16 days on average, but 1 in 12 women will bleed for more than 30 days, and 1 in 100 women will require hospitalization. Chemical abortion also has a failure rate that increases as the pregnancy is further along, leading 4.1% of women to have to undergo a surgical abortion to complete the procedure. There are numerous side effects to chemical abortion, including fever, infection, nausea and vomiting, diarrhea, hemorrhage, blood clots, and even risk of maternal death. In order to protect both women and preborn children in Indiana, chemical abortion must be outlawed. Every child has the right to be born, and allowing chemical abortions to occur in Indiana jeopardizes not only the rights of the preborn child, but puts women at risk of experiencing severe side effects and trauma. I am deeply concerned that SB1 fails to address the most dangerous form of abortion. Chemical abortion leaves both woman and child at risk, being 4 times more deadly to the woman than any other procedure. There is no such thing as a safe abortion, considering every abortion intentionally kills an innocent, living, distinct human being, but this bill is far from safe for women as well, as it poses chemical abortion as a solution to an unexpected pregnancy rather than offering support and life-affirming resources. Hoosiers want substantial, real pro-life legislation that bans chemical abortion and provides protection at conception across the board. Have courage and protect both our women and our children. Again, I stand in opposition to SB1 for this reason. Thank you.
Mr. Hill, thank you. Did you say you're a senior in high school?
Yes.
Very well done. I'm happy to have you here. Are there questions for Mr. Hill? Okay, thank you, Mr. Hill. Thank you.
Where do I exit at?
I'm sorry?
Where do I exit at?
You go out that way and to your left.
Thank you.
Yes, thank you so much. Marissa Jensen.
Hi, my name is Marissa Jensen, and I'll be testifying in opposition of the bill. Look at me, take a good look. Again, my name's Marissa Jensen. I'm a 17-year-old female that came through foster care. But according to you, I shouldn't be here, right? According to you, I should have been aborted, right? Because to you, a child that would have had to go through foster care is better off dead. I stand here before you, disgusted that I even have to be up here to fight for the rights of the unborn. I have come from everything that you say should give a woman the right to abort their child. I was unplanned. My birth parents weren't married. They weren't financially stable enough for me. We were homeless, and they were drug addicts. All reasons you deem appropriate to call for my death, right? And on top of that, you sit here and say that a child would be better off dead than to go through foster care. So are you going to look me in the eyes and tell me that I don't deserve to be here, that I would have been better off dead? Foster care was hard. Life is hard. Hard times make you stronger. I am strong because of what I had to experience. It made me into the person I am today. I've already mentioned that I'm a mere 17 years old. So what is it that I get that you don't? I know it's a baby. Science has proven again and again that an entirely new human being is created at the moment of conception. This shouldn't still be up for debate. It's a baby. You all know it's a baby. And it amazes me that you still sit here and think it's okay to murder the preborn. So if it's okay to kill a baby up until the moment of birth, when is it not okay? When do you draw the line? When do you finally say, that's enough? We live in a day and age that it's okay to be gay, it's okay to be transgender, and it's okay to identify as an animal, but it's not okay to be preborn. The thing about all those people, the people a part of the LGBTQIA community, is that they can speak up for their rights, but the preborn can't. So I stand here before you to be the voice that they can't be. So stop killing us.
Quiet, please. Quiet, please. Are there questions for Ms. Jensen?
Mr. Chairman.
Senator Taylor?
Thank you. You have a lot of passion, and I just thought I'd speak up for those who you think would want you to not be here. I think this state is better off with you here. And I think the entire discussion about the legislation is going to reveal how a lot of people feel about this issue. But let me just leave you with this. There's a lot of decisions that you're going to have to make in your already young life. Please, please, recognize that that passion you just used right there needs to be used for those decisions later on in life too. But nobody's here, at least I can speak for my colleagues, that says that we want to get rid of unborn children. But thank you for your presentation. You did a great job.
Thank you.
Any other questions? Thank you, young lady. Thanks for coming. All right, next is Dr. Ott, and I want to announce the next line of folks to testify after Dr. Ott is finished. Nathaniel Mervar, Carrie Jensen, Merrick Kaiser, and Amy Rainey. That's Nathaniel Mervar, Carrie Jensen, Merrick Kaiser, and Amy Rainey. Dr. Ott, welcome.
Thank you. I'd like to thank the chairman and the committee for the opportunity to speak. My name is Mary Ott. I'm a pediatrician, and I'm testifying for the American Academy of Pediatrics Indiana chapter. The AAP represents 67,000 pediatricians nationally and 74% of pediatricians in Indiana. Comprehensive, evidence-based reproductive health care is a cornerstone of child and adolescent health. Access to safe and legal abortion is an essential component of this reproductive health care. This is an issue of both health and justice. Bans on abortion pose a threat to the health and well-being of Indiana youth, impacting physical, mental health, educational, and economic outcomes, including higher adolescent maternal mortality. Pediatricians additionally support an adolescent's decision-making capacity and autonomy over their reproductive health choices in future. In pediatrics, medical issues are best decided by patients and their families in consultation with their physicians. Adolescents should be able to work with their physicians who have training and expertise to make reproductive health decisions that are informed by their individual medical needs and personal values. The proposed legislation politicizes what should be a private decision. Access to abortion is a health equity issue relevant to pediatricians. Indiana ranks 37th nationally in adolescent pregnancy, and young people face more barriers than adults in accessing services. This legislation will deepen the additional reproductive health disparities faced by young people of color, who make up 30% of Hoosier children, young people in the child welfare and juvenile justice systems, LGBTQ young people, and young people in rural and medically underserved areas. The AAP, as an organization, is committed to prevention. Research shows that the best way to prevent adolescent abortion is not to ban the procedure, but instead to provide comprehensive sex education and expanded access to contraception. Sex education that teaches about the full range of contraceptive options provides Hoosier youth with the tools that they need to make healthy decisions. Equally important is same-day confidential contraceptive access, including IUDs and implants. When Colorado provided same-day access, they dropped their adolescent birth and abortion rates by 29% and 34% respectively. If Indiana is truly committed to decreasing adolescent pregnancies and abortions, we need state laws that support minor consent to contraception, comprehensive sex education, and funding to assure same-day, low-cost, confidential access to the full range of birth control options. Thank you.
Are there questions for Dr. Ott? Senator Landon?
Thank you, Mr. Chairman. Thank you for your testimony today. And one of the main concerns I have with the bill as written is, will physicians even understand what we're saying to them? Have you read the legal jargon in this bill as far as, for example, the definition of what constitutes reasonable medical judgment? And do you have a comment on whether or not it's appropriate language from your point of view as a physician?
So some of my colleagues will be testifying on that aspect.
Well, that's fine.
You know,
I just want to make sure we do have expert testimony on this, because if I understand this bill, your medical licenses are at jeopardy if you transgress the provisions of the bill. So we better make sure we've got the language correct. As much as I disagree with the bill, it's got to be written correctly. So thank you very much.
Further questions, Senator Melton?
In your remarks, you mentioned, you suggested comprehensive sex education in the state of Indiana. Are you aware of how we're implementing that now in terms of our state standards in education?
Our state educational standards currently require education in HIV and embryology. If a school corporation chooses to have sex education, they must focus on abstinence. It doesn't preclude comprehensive sex education, and we have school corporations that do in fact use comprehensive approaches to sex education, but only abstinence, embryology, and HIV are required.
So do you suggest that our current state law in that area is sufficient, or are there elements that we should explore?
Yeah, I would suggest that we require comprehensive sex education to give young people the tools that they need to make healthy decisions.
All right, thank you.
Senator Yoder?
Thank you so much, Mr. Chair, and thank you for your testimony. I have a question that I would like you to speak to. Maybe there are two questions. The first one is current law and even how Senate Bill 1 is written. Can you speak to, in your practice as a pediatrician, a 13-year-old could be raped by her father, and then the way that the law is, need to ask for his permission for an abortion or to receive care, to receive abortion care. Can you speak to that as a pediatrician? And secondly, I was curious if in your practice, when seeing children, currently we are, as Senator Melton said, we are poor at providing comprehensive sex education. In your practice, what do you see? Do children know what has happened to them to provide a vocabulary around rape, incest, when they come to see you or other pediatricians in this state?
The I'll answer the second part first, but the American Academy of Pediatrics considers comprehensive reproductive health care an essential part of pediatric care. Bright Futures, a publication by the American Academy of Pediatrics and by the Maternal and Child Health Bureau, recommends that pediatricians talk with young people about and screen young people for sexual coercion. And we recommend utilizing referrals and tools like the Centers for Hope, and we'll have someone testifying from a Center for Hope about what to do in situations of rape and incest. But certainly it's a part of what we do as pediatricians.
And just as a follow-up, it is such a privilege actually to have a pediatrician. There is a bit of a lack of that specialty. And I just appreciate you going into that field. And I know the state of Indiana, we need more pediatricians.
Thank you, Senator.
Senator Yoder, I want to provide one moment of clarification with regard to the first part of your question. Under that scenario where a child would be raped, would have to have permission from the parent, potentially the father who raped her, in order to get care. And that is not necessarily the case in Indiana law today. And if this bill were to pass, there would be an option for that child to go through and get permission from a court that would not need any parental consent to do that. Are there any further questions for Dr. Ott? Doctor, thank you for being here today. Appreciate your time.
Thank you for the opportunity.
Nathaniel Mervar is next, Carrie Jensen, Amy Rainey, and then after that will be Dr. Mary Abernathy. Dr. Mary Abernathy will be after Amy Rainey.
My name is Nathaniel Mervar. I am here today to oppose SB1. I wish I could say I was glad to be here, but I'm not. Over 70 million preborn babies have lost their lives through the horrors of abortion. We are told in our Declaration of Independence that government is instituted to protect our inalienable rights that are given to us by our Creator. And the first and foremost of these rights is the right to life. We have a crowd out here chanting right now that wants to continue killing and murder of innocent babies. If government does not protect life, our first right, none of the other rights in the Bill of Rights matter. And yet we have babies that have been slaughtered in the name of choice and convenience. And for 50 years, this chamber has told us that we cannot abolish abortion because of Roe v. Wade. Now Roe v. Wade has been overturned, and yet there is no bill to ban abortion outright. I'm asking the SB1 language be stripped and a bill be replaced with the language similar to HB 1282, which was a complete ban on abortion with no exceptions, no compromise, no regulation. There is an almighty God that rules over the affairs of men. And my prayer is that even if you do not fear me or any of the other people out here, that you would fear God and do the right thing. Once again, abortion is murder, and these babies deserve to be protected. And I would be quite glad to answer any questions.
Senator Lannon.
Thank you, Mr. Chair. Thank you for your testimony, sir. In all due respect to your comments, those are your religious beliefs, is that correct?
Yes, sir.
And those are your opinions based upon your religious belief?
It is not my opinion. It is the Word of God that forms my decisions.
Would you also agree there are many people who have other beliefs and opinions that are counter to yours? Those are the folks that we hear out in the hallway. Is that right?
According to our founding documents, this nation was founded on God, the laws of nature, and nature's God. So yes, I would agree they have differing beliefs, but we're a nation that's founded on God's laws.
So a lot of this whole bill is based upon people's good faith opinions and beliefs. We just disagree. Is that correct?
In the case that abortion is murder, yes, I would say we probably disagree.
Thank you.
Okay, thank you.
Thank you.
Carrie Jensen. And as Carrie Jensen comes up, the next after Dr. Abernathy will be Emma Duell. Emma Duell. Ms. Jensen, go ahead.
Sorry.
Thank you. No, perfect.
My name is Carrie Jensen, and I oppose SB1. I am a mom of 4 kiddos, 3 of whom were adopted through the foster care system. And I appreciated, he's not here now, the senator encouraging my daughter with her passion. There's a very real group of people out there right now who truly do believe that if any child is born into difficult circumstances, or circumstances that might not be ideal, it would be a kinder and better choice for them to never have been born. Proverbs 31:9 says, "Open your mouth, judge righteously, defend the rights of the poor and needy." I stand before you, humbled and honored, to speak on behalf of our neediest, our preborn neighbors. Yet I am appalled and astonished that I have to stand before you, our elected officials, mothers, fathers, aunts, uncles, and grandparents, to plead with you to not pass SB1. This is a bill which lacks the language to offer any protection to the lives of the preborn. I often minister out at the abortion mills, and I have heard on a number of occasions that we must allow abortion on demand because a child born in a less than desirable circumstance will surely end up in foster care. You would look at the faces of my children, including Marissa, who is just up here, and tell them, had we known that you would have ended up in foster care, we would have called for your death. Please don't think I'm just being an emotional mom. I hear these things from men and women who are going in to pay someone to murder their child. This is not a resources issue. They are offered money, they are offered housing, diapers, a safe place if they're in an unsafe situation. This is not a resources issue. This is a heart issue. And while we may disagree that the heart, my heart is where it is because of my Lord and Savior. And I won't apologize for that, and I won't even say that I agree to disagree. If you're okay with the slaughter of preborn babies.
30 seconds, ma'am.
And I'm not talking about men making rules for women. I'm not talking about legislators making rules for people. I'm talking about humans protecting humans. We would go to the field for those who are already born. Why is it not the same for those who are still in utero? Thank you.
Thank you. Are there questions for Ms. Jensen? Senator Melton.
Thank you, Mr. Chair. Thank you for your testimony. I appreciate your passion. The one thought that came to my mind in your testimony that I disagree with in terms of how you kind of characterize or frame everyone outside of the chamber believing. Can you repeat that again? You said everyone outside the chamber.
I was going off the cuff, but yes, something like that. The people who are out there currently screaming, "Our body, our choice," I would say the majority of them, yes. I may have said all, but I would definitely say the majority of them would use that tagline to defend their position.
Well, I think without speaking with them or individuals with them that's here, I think it's kind of hard to characterize everyone and they have a single belief on the reason why an abortion may be needed. There may be a variety of other reasons, right? Mm-hmm. And I think that's the gentleman that spoke before you to talk about what this country was founded on. But I also think when we look at the country from a freedom perspective and just having their own opinion, I think that might be characterizing folks in this conversation in a different way.
I agree with you to a point. My problem comes in when the freedom of another person is impinging on the freedom of the unborn to be born. There are few things in life as clearly black and white as somebody being murdered for the convenience, for whatever reason. This is a black and white issue. This really should not be up for debate. And so when I talk about the people that are out there that I hear the bloodlust in their voices. I hear that. And that's the same thing that we experience outside the abortion mills when we offer hope and help.
I think the part that kind of stood out to me, you said convenience. I think that's the part I have a lot of serious problems with a lot of what you said. Mm-hmm. But that convenience part, I think, mischaracterized a lot of what a few people believe. So just my thoughts.
Understood. Thank you.
Okay, thank you, ma'am. Thank you very much for being here. Next is Amy Rainey, and then Dr. Mary Abernathy, and then Emma Dool, and after that will be Merrick Kaiser. So Amy Rainey, Dr. Mary Abernathy, Emma Dool, and Merrick Kaiser.
Hello, my name is Amy Rainey. Today I'm here speaking on behalf of two people that are not able to speak for themselves. The first is my daughter, who was nearly robbed of her right to take her first breath. The second is her mother. Both meet the federal definition of a vulnerable population. I would like to first share their story and then share the language in this current bill that is not acceptable for the protection of vulnerable populations. My daughter wasn't conceived of under the best circumstances. In fact, nobody remembers how she was conceived. Once my daughter's mother became aware that she was pregnant at about 16 weeks, she went to see a doctor. That doctor recommended that the child be killed. Imagine the first doctor that ever examines you, looks at you and says, yeah, kill this one. He didn't even give a reason. There was no medical justification. There was no medical diagnosis. No discussion of impact on carrying the pregnancy for the mother. No discussion of a medical condition of the baby. The medical record merely states, recommend abortion. A verdict, the non-guilty, with the wave of a pen. This baby doesn't deserve to live. Section 6 of SB1 defines reasonable medical judgment. It goes on in Section 8 to state that abortion is unlawful unless a physician decides a substantial permanent impairment of life of the pregnant woman may exist. This language is so unclear that it could be expanded to any medical condition, including mental health. The language does not even require the physician document the rationale or receive approval and oversight from anyone. This is a much weaker standard than the language in the current legislation for abortions occurring after 20 weeks. My concern with the current language is the bill allows a single person following no set standard to move vulnerable women towards an abortion decision that is often not needed or desired. As elected representatives of the vulnerable people you serve, it is your responsibility to protect vulnerable people in your state. It is your responsibility to ensure the right to life is upheld. This bill passes full responsibility to individual doctors. Individual humans are heavily prone to bias. We simply cannot allow individual doctors to create abortion policy on a case-by-case basis. That approach does nothing to protect vulnerable women or preborn children and leaves them open to accepting the opinion of someone who will financially benefit from killing their child. Our story has a happy ending. Mom ignored the medical advice this time. God spoke to her and told her that life is precious and that he had a plan and a legacy for her child. There are lots of intellectual arguments that say killing a preborn child is kind or merciful or freeing. People make it sound very complicated, but at the end of the day, you can look into the big brown eyes of my daughter and of the 100,000 other children that have been murdered in Indiana in the past decade and say, I'm sorry, you don't get to breathe. When you make the stroke of your pen to vote on this bill, what proclamation will you make on children like my child, Virginia? I urge you to do the right thing and kill this bill, not more babies.
Are there questions of the committee? Thank you very much. Dr. Mary Abernathy. After that, it'll be Emma Dool, Merrick Kaiser, and Thomas Moore.
Good afternoon. My name is Dr. Mary Abernathy. I am testifying today on behalf of myself, Indiana American College of OBGYNs, and not on behalf of my employer. I am a maternal fetal medicine specialist helping to provide high-risk pregnancy care in the Wabash Valley. I also serve as the chair of the Indiana Maternal Mortality Review Committee. The Wabash Valley has been plagued with OB deserts and high infant mortality rates. One of our initiatives to decrease infant mortality is to work with family medicine providers that have not been providing maternity care to re-engage them into maternity care to increase maternity access for our mothers. Our goal is for them to provide basic maternity care locally and then transfer her care as she gets closer to term to a hospital that can manage that care. This initiative requires trust and communication between the providers, as well as trust between the patient and her providers. It allows a woman to get that vast majority of her prenatal care in her local community. I am concerned with an unintended consequence of the current legislation. My concern is that OB providers in rural areas will simply decide to stop providing maternity care or choose never to restart with our program. I fear that they will become worried that they might run afoul of the law somehow. Most providers in rural areas do not work for large hospital systems that can provide them with ongoing guidance. I can understand how they might think it's just easier not to do obstetric care than to accept any risk. Losing any obstetric providers in rural areas will only increase infant and maternal mortality as rural mothers lack access to obstetric care providers and transportation. My other concern regarding a total ban of abortions with exceptions, as proposed, is that it will disproportionately affect mothers of color and low-income mothers. Unfortunately, those are the very same mothers that are all too often on our maternal mortality case review list. Women of color and women of low income have a disproportionate share of chronic medical conditions, obesity, hypertension, diabetes, and smoking, that can affect their mortality. One recent study estimates with a total ban, there would be a 21% increase in maternal deaths and a 33% increase in Black mothers. This study did not include deaths from unsafe abortion practices, which may be even more prevalent in that age group. I urge you to reconsider a total ban to set our state on a course where we must provide care to our mothers that they choose in consultation with their providers that they know and trust. I'd be happy to answer any questions.
Doctor, thank you. Senator Yoder?
Thank you, Mr. Chairman, and thank you, Dr. Abernathy. I was just wondering if you could, if it's a matter of repeating, could you speak specifically to how this bill will impact maternal and infant mortality in the state of Indiana?
So there are three ways that I can come up with easily. The absolute mortality risk of carrying a pregnancy is about 50 times higher than the mortality risk of having an abortion, based on CDC data. The second way is what I described, which is where you would have providers that are fearful in the current environment of continuing to do obstetric care. And I can imagine myself being in the later half of my career saying, oh Lord, I don't know that I want to deal with that, okay? The third way is that I fear that affluent white women will be able to travel out of state and that they will be able to get an abortion. Your low-income, single, unmarried Black mother probably will not have the resources and capability to do that. And so therefore, you're setting up disparate care, and some people would dare to even say the words systemic racism. And I don't think any of us want that to happen to our most vulnerable mothers.
Thank you.
Senator Melton?
Thank you, Mr. Chair. Just want to comment on your last statement and also ask a question after that. And because one of the things that bring me grave concerns that Indiana is already ranking at the bottom when it comes down to infant and maternal mortality rates. And living in a part of the state that has a very high Black, brown population, I'm seeing it hands-on, firsthand, so that impacts. Well, thank you for your remarks and reminding folks how this can impact folks in their general population across the state of Indiana. My question would, could you please explain, and you mentioned this earlier, what is maternal fetal medicine physician, and what does that mean?
So I help women who have complicated pregnancies have the best outcome possible. That can be a complication from a maternal disorder, diabetes, high blood pressure, substance use disorder, smoking, whatever it is. I help get her to navigate her so she has the best outcome. The other half of my job is to look at infants, fetuses on ultrasound, and to kind of counsel women based on the finding that was usually found in their doctor's office. So sometimes that means they have to deliver somewhere else. Sometimes it's just something that we watch and will need to be followed up afterwards. And unfortunately, sometimes we diagnose what I would call a lethal fetal anomaly, or we know that the infant's not going to have survival after birth, such as in cases of anencephaly or renal agenesis. And so it's kind of a combination of both that gets thrown at me every day.
Just a follow-up question to that. We're going to be talking about a lot of different subject matters this while we're in special session. I know we're going to be allocating some funding towards issues and initiatives. What can we do as a state, since we're very fiscally sound, we have over $6 billion surplus, what can we be investing in terms of preventative type of services in the state of Indiana?
So our number one cause of maternal deaths, when we look at any woman who was died while pregnant or within a year of being pregnant, is due to substance use disorder. And during our kind of investigation, so each case we investigate very thoroughly. During our investigation, it's become very apparent that many women will use illicit substances when they have a mental disorder, depression, anxiety, because we don't have enough mental health providers to help take care of the women. So they use what's more commonly available sometimes is illicit substances. So my number one goal would be for us to provide better mental health services on every block, on every corner, however it needs to happen. We need to make sure that we have more than adequate behavioral health, mental health resources available. And with doing that, you would eliminate 30 to 40% annually of our maternal deaths if we can get a mother into care.
Right. And last question, as a follow-up to that, as a healthcare professional, would you say that the pandemic has heightened the order of depression and substance abuse
Yes.
in the state?
Oh, obviously. And in fact, our maternal death rate from 2019 to 2020, we saw a 50% increase in our maternal deaths. That report is going to be released sometime later this fall.
And that's statewide?
Correct, statewide. So we usually had about 60 to 70 on average deaths for 2018, 2019. 2020, we had 91 maternal deaths. Not all were due to COVID, but I certainly think the pandemic worsened many of the conditions. Right. So it's indirectly due to a pandemic and lack of medical care that probably was worsened during the pandemic.
Right, so it would be a good investment. Thank you.
Thank you.
Senator Lennon.
Thank you, Mr. Chair. Doctor, have you had an opportunity to read the bill?
Yes, I tried to. There's a lot of referrals back to IC 16
Right.
and I didn't have all those there. So, but yes, I did read the bill.
I guess the concern I have is, does it provide sufficient guidance to a physician as to what are the parameters in making a determination that an abortion is legal?
I think there is some leeway there that will be subject to interpretation.
Right.
So yes, I think that Indiana ACOG would love it to say the health as well as, you know, the medical care of the patient.
Right, because if I understand the essence of the bill, abortion is basically illegal, except with very limited exceptions. And in all cases, a physician, as far as a surgical abortion, the abortion has to be performed, of course, by a licensed physician. The physician determines, that uses this phrase, based on reasonable medical judgment, that an abortion is necessary to prevent a substantial permanent impairment of the life of the pregnant woman. Is that specific enough, in your opinion, to guide a physician as to, are they within the law to?
I think it does leave a great deal up to interpretation. I think that some people may use that to their advantage and say, you know, I think that this is going to lead to damage eventually. I think there will be other people who probably, physicians who probably practice in a more rural community that may say, when is it enough that I can say it's going to lead to irreparable damage? Right. So well, I think there is some subject of interpretation there.
And as I read the bill, there's no definition of what is a substantial permanent impairment of the life of a pregnant woman. And then there is a definition for what is a reasonable medical judgment, which is defined in the bill, means a medical judgment based upon the facts known to the physician at the time, that would be made by a reasonably prudent physician who is knowledgeable about the treatment possibilities concerning the medical conditions involved. And I guess the concern I have there, in many cases, are women, pregnant women being treated not by an OBGYN, but by a general practitioner.
So many times, and I think what they're referring to there is, it's a multidisciplinary team, because some women with what we would call class 4 cardiac conditions, we would actually counsel them, as well as the cardiologists who we're working with, that pregnancy is contraindicated. And so I believe that was the interpretation that I got out of there.
So if you were a general practitioner, would you feel, well, I don't have the knowledge about the treatment possibilities of a pregnant woman who has a underlying cardiac situation or neurological situation, and do you think it will chill their right or their ability to form a medical opinion in these cases?
Correct.
With this language?
What would most likely happen in that case, they would be referred to a maternal fetal medicine specialist.
Right.
And then we would have that conversation with them.
And that's assuming that that type of health care is available too.
It is in most of the large cities.
What about the rural areas of Indiana?
Well, that's again what I'm trying to work on in the Wabash Valley,
Yeah.
by providing care there.
So it's going to result in unequal care,
Yeah.
perhaps, for
Yeah,
pregnant
but-
women in this situation?
I think sometimes we work hard to get women back into care or into Indianapolis where their cardiologist is, and so we work hard to do that.
Thank you.
Anything else?
Doctor, thank you. Appreciate your time.
Thank you.
Yeah. Next on our list is Emma Dool, and then on deck is Merrick Kaiser, Thomas Moore, then Caleb Manring, and Dr. Daniel Elliott. Excuse me, Isaac Manring.
Yeah.
Isaac Manring, then Dr. Daniel Elliott.
May I begin?
Yes, please.
Thank you, Congressmen and women. My name is Emma Dool, and I'm a pro-life student from Noblesville, and I'm opposed to Senate Bill 1 as it is currently written. I just turned 16 this past week, and I'm pro-life because I believe all people deserve equal human rights just because they're human. As a student of history, I look back on the greatest human rights abuses and see that they are justified by human plus fill-in-the-blank mentality. This mentality works by adding an extra qualification to having human rights. So for example, it was you must be human plus white to live freely, or human plus male to vote, or human plus having blue eyes and blonde hair to survive. Why wasn't being human enough to have human rights? Why did other qualifications have to be met that had no bearing on one's humanity anyway? I believe Senate Bill 1 has great potential, but I am very concerned about the rape and incest exception because it follows the same abusive and discriminatory logic. This bill says you must be human plus conceived in love to have human rights, otherwise you can be murdered in the womb. I don't believe this is moral, and I don't believe this is just. I don't believe children should be murdered based on their circumstance of conception. What happened the night they were conceived, something they have no control over, should not affect whether they are protected from abortion violence or not. If preborn children are worth protecting, they are all worth protecting equally. Because one's circumstance of conception has no bearing on their humanity. By adding this extra qualification to receiving human rights, we are repeating the same deadly logic that justified racism, sexism, and the Holocaust. You'll have to excuse my bluntness. I don't mean this to be inflammatory, only straightforward about the terrible reality this exception will have on preborn Hoosiers. Please, you still have time to amend this bill to protect all preborn children equally, because being human is enough to have human rights. Saying a preborn child must meet an arbitrary qualification that politicians have drawn in the sand is an injustice. So please amend this bill to be stronger. Amend this bill to protect all preborn lives and affirm that being human is enough to have the human right to life. As William Wilberforce once said, "Let it not be said that I was silent when they needed me." As a pro-life high schooler, I know the fight for life can be a lonely one. I get harassed, I've lost friends, I've been bullied by my teachers, and I've received death threats, among other things. but defending the defenseless is well worth the struggle because human rights are for everyone, regardless of their race, regardless of their sex, regardless of their appearance, and regardless of how their life began. Everyone deserves a birthday. Thank you.
Thank you, Ms. Duell. Are there questions from the committee? The chair is seeing none. Thank you very much for your testimony. Next is Merrick Kaiser. Again, the list after that, Thomas Moore, Isaac Manring, and Dr. Daniel Elliott.
I'm a high schooler from Fort Wayne. Where do rights come from? From God alone. Whose rights are at stake with this bill? The preborn. Science and human embryology are clear. Life begins at conception, not at implantation, which this legislation fallaciously asserts. This bill denies the right to life to these preborn children just on the basis of if one of their parents was a criminal. Sorry, little one, your father assaulted your mother. You don't have the right to life. That is what the gong of the Indiana Senate is ringing right now. He that justifieth the wicked and he that condemneth the just, even they both are an abomination to the Lord. This bill justifies the wicked by removing meaningful culpability from these murderers that we see at the clinics, and it condemns these innocent ones simply because of the circumstance of their conception. Over the last 2 years, I've spent many countless hours traveling all across the state, fighting to see an end to the Holocaust in our midst. I've spoken with literally thousands of people, I'm sure, on the topic of these exceptions. And what I found, the narratival theme I found, is that rape and incest are horrible violations of a person, and that's why they're wrong. It's the stronger person using their body to violate someone else. But that's exactly why abortion is wrong, because it is the stronger person, the stronger abortionist, the stronger mother violating that life of that child in there. I have to warn you. The Bible says that upon those who love violence, God shall rain fire and sulfur. Don't be counted among the abortionists who hate death, or who love death because they hate life. Abortion must end now. This bill simply regulates abortion and therefore sustains and assumes the continued preexistence. I read the bill. It specifically mentions regulations for future abortion clinics. This is not a ban on abortion. Even for those who do support exceptions, SB1 is contradictory and horribly ambiguous upon affidavit confidentiality, clarity upon definitional issues such as substantial permanent impairment to the mother, as we've heard, and again, it completely relies upon an unscientific notion that redefines pregnancy. Understand this, with the current Indiana code, if this bill goes into effect, a woman can have a separate human physical life, the code says that begins at conception, inside of her, and yet not be pregnant. That's nonsense. And again, it redefines that specifically for the idolatrous things of Plan B and IVF. We should close those too. Be consistent. Serve the Lord with fear. You are God's magistrates. God has appointed you, and so you should bid to follow his laws. Senator Cruz, I know you're retiring soon. This legislation is the most important you will ever work on. There's a blood guilt in our state because of these preborn babies, and you have the chance to do the right thing here. So I oppose this bill for these reasons. And I'll answer any questions.
Thank you, Mr. Moore. Does the committee have questions of Mr. Moore? The chair sees none. Thank you very much.
Thank you.
Next, Isaac Manring, Dr. Dan Elliott, and then Seth Lehman will be the next. So Isaac Manring, Dr. Daniel Elliott, and Seth Lehman. Go ahead, please.
My name is Thomas Moore, and I oppose SB1. I think it's become very clear that life begins at conception. Science has shown that. Like, there's not been question in that. And when we look at life beginning at conception, how do we begin to regulate it? We don't do this with people that are living. We don't look and say, well, murder's wrong most of the time, but you know what? You can murder if you're in really bad situations. Like, it's wrong. Life begins at conception. And so for us to come in and begin to regulate when is it okay, when is it not, it's still wrong. Like, we have to protect life. And these preborn babies don't have a chance to do that. We've got to stand up for them, and this is our chance to do that. Indiana is a conservative state, and we've been known for one, and we have a chance, finally, to stand up for beliefs, for life, And as you guys sit here, let's not find a compromise. Like, if life matters, then regulating it isn't the answer to it. If there's challenges with these pregnancies, then put money toward that. Foster care, well underfunded. I've been a part of foster care as a foster parent. I work alongside other people that are in the foster community, and I see challenges there. You know, caseworkers overloaded. So if we want to address things, let's not say murder's okay, but let's look at other situations. Put money toward that. Put money toward resources for mothers. Those things are great. Take tax dollars if you're going to do something and put it toward those, but let's not be legislators that are a part of writing laws that are going to allow murder. Don't take part in that. James 4:17 in the Bible even says, whoever knows the right thing to do and fails to do it, for him it is a sin. I know many of our senators here, you profess to be Christians, and this is your chance to stand up for what is right. Fear God and not man. It doesn't matter if you get reelected or what the opposition says. You're here because God has placed you here. And so I just challenge you, and I urge you to stand up for that. Stand up for what is right. Psalms 139 says, for you formed my inner parts. You knitted me together in my mother's womb. I praise you, for I fearfully and wonderfully made. Wonderful are your works. My soul knows it very well. My frame was not hidden from you when I was made in the secret. We are made in God's image. Our lives matter, and this is your chance to stand up for it. So I just call you guys to do that. Kurt Isley has, HB 1282. Let's go back to that. Let's abolish abortion and stand up for what is right.
Thank you, Mr. Moore. Are there questions of the committee? Senator Yoder.
Thank you, Mr. Chairman. I have a question for you. Let's see here, Isaac?
It was Thomas Moore.
Thomas Moore.
Thomas Moore. I wanted to ask if you have seen the letter from the multi-faith leaders in our state who strongly would disagree that that a person of faith, that a Christian could not come at this differently, that with compassion and belief, one would believe differently. So it's signed by, I don't know if you've seen it, I can't even count up all of the different clergy members who have signed this. And I was just curious if you've seen it.
I've heard about it. I have not read it, but I had sent a message on it this morning, if it's what I think you're talking about. No matter what that says, the Bible is very clear in what God opposes murder. That's very clear, and science has shown over and over that life begins at conception. And so, no matter what they say, it's wrong. So,
Thank you.
Senator Melton.
Thank you, Mr. Chair. Thank you for your testimony. I'm one of those individuals that believe in God, and I'll try my best to be a good Christian. Indiana is a state that still has the death penalty. Would you support abolishing the death penalty in the state of Indiana?
Yeah, God places government, I think, for judgment, and he appoints them, and we see over and over through, as much as it's not good, we see things that happen, and it's not something I would speak on very well. I don't think, if it was up to me, I would definitely say, let's not.
Let's not what?
Sorry, let's not. I would be against the death penalty. Sorry.
Okay.
Because their lives do matter, and I would focus more on how do we put dollars to try to help them, no matter what the situations have been. So.
Yeah, because I want to have conversations with folks about this, and we not bring that aspect up in terms of if we're going to be pro-life, let's be pro-life all the way through, no matter what. If we're talking about the conversation you and I are having right now. So I just wanted to get your thoughts and perspectives on that, and it was helpful. Thank you.
Cool. Thank you.
Mr. Moore, thank you. Next, Isaac Manring. After Mr. Manring, then Dr. Daniel Elliott, then Seth Lehman, and then Rabbi Aaron Spiegel will be after that. So, Mr. Manring, go ahead.
Hello. I would like to begin by asking you a question fundamental to any legislation restricting abortion. If you oppose abortion, why? Any reasonable opposition to abortion is based on the fact that abortion brutally destroys human life. We hold that human life is a precious gift which we do not have the right to take. If you think about it, we employ this exact same reasoning when it comes to issues of murdering toddlers or infants. And so what I'm asking you to do today is to be consistent in your application of this principle. We do not treat infanticide as a misdemeanor, as Senate Bill 1 treats abortion. We do not protect the perpetrators of child abuse from the full extent of the law, as Senate Bill 1 does by specifying that the crime is not feticide. We do not give providers vague directions about circumstances in which they can take the life of a 2-year-old. We do not make exceptions for murder of children based on parents' circumstances, as Senate Bill 1 does for abortion. Senate Bill 1 is full of loopholes, and it has no teeth and no enforcement. While pretending to stop abortion, it makes specific provisions for future abortion centers. It's a fraud masquerading as a pro-life bill. If you oppose abortion, be true to the reasons why you oppose it, and end the intentional killing of innocent human beings. Vote against Senate Bill 1.
Thank you. Are there any questions? Okay, thank you very much, sir. Dr. Daniel Elliott. After that will be Seth Lehman. And then Rabbi Aaron Spiegel.
Thank you, Chairman and committee members. My name is Dr. Daniel Elliott, and I'm an emergency physician practicing here in Central Indiana and the current president of the Indiana chapter of the American College of Emergency Physicians. I'm one of over 600 emergency physicians across this state who care for women who present with pregnancy-related crises, such as miscarriages, ectopic pregnancies, and victims of sexual assault. These women come to us in their darkest moments and depend on us to provide life-saving care for them without judgment or fear of legal retribution. I stand here today on behalf of Indiana ACEP, who is neutral on the current language of this bill. We would like to, however, highlight several points of emphasis that we feel are crucial to continuing caring for Hoosier patients in the emergency department. First, we believe in the sanctity of patient-physician relationships and do feel the current language is supportive of this within emergency medicine. We believe that legislation should never compromise an emergency physician's ability to have an honest discussion with patients about their health or to evaluate all treatment options. We want patients to be able and willing to seek out emergency care without fear of legal ramifications or judgment. Second, we want emergency physicians to be able to provide life-saving interventions and treatments consistent with the standard of care without fear of prosecution. We believe our commitment to patients and our dedication to leading care teams that provide high-quality, objective, and evidence-based emergency care is first and foremost in our minds at all times. We feel the current language within this bill does provide these protections within emergency medicine, and we encourage in any modified or amended language to continue to provide these protections for emergency physicians and our patients. Thank you, and I'm happy to take any questions.
Dr. Elliott, thank you. Thanks for being here. Are there questions from the committee? Senator Yoder.
Yeah, thank you, Mr. Chairman. And I appreciate your testimony, Dr. Elliott. I was curious, do ER physicians have access to legal support 24/7?
So I can't speak for every emergency physician, though most hospitals will have a legal department, risk management department. So if you're talking about like within practicing, I would say they should, usually within the confines of a health system. Yeah.
Thank you.
Senator Taylor?
Thank you, Mr. Chairman. Did I also hear you say you were neutral on the bill?
So as far as the overall current language, our practice, we are neutral on this current bill, yes.
Can I ask why you not taking a position as a medical professional on a 50, how can you have a neutral opinion on a law that's been in place that you've been practicing under for 50 years and it's about to change and you don't have an opinion about the language?
So we are a group of emergency physicians who obviously have very divergent opinions in a very divisive issue across this country. And as an overall group, we want to focus on emergency care and what affects the emergency physicians. And so that's why on the overall bill, we are staying neutral at this point.
So I'm still perplexed by this because as an emergency physician, your doctors, your members will be put in a direct position to determine the outcome of an emergency situation that could mean aborting a child, and you are neutral?
So we feel, after reading this current bill, that the protections are in there for situations that we encounter within the emergency department.
Okay.
In those life-threatening situations. And
Life-threatening for who?
For the mother.
What about the child?
For the child as well.
The unborn child?
So
you think this bill protects the unborn child?
Within the confines of the emergency department, the patients that we see that are coming to us in the emergency department, we at least feel that this does give us protection, at least the current language.
Well, Dr. Elliott, let me just say this. As someone who is not a doctor, I have a doctorate degree, but don't call me doctor. It's in jurisprudence, not medicine. I find it disturbing that a professional organization like emergency physicians would not have a position on this bill, or at least say neutral. I hope you come back because, as the author indicated to you, this is not the last reiteration of this bill. It's just a, quote, if I quote you wrong, Senator Glick, this is a framework. So you might want to gather your members up and be ready for emergency board member to determine whether or not you're neutral or not. Thank you.
Dr. Elliott, thank you. Thank you for being here. Next up is Seth Lehman. After that, Rabbi Aaron Spiegel, and then Andrew Mullally and Joseph Boardcup. So Seth Lehman, Rabbi Aaron Spiegel, Andrew Mullally, and Joseph Boardcup. Go ahead, please.
Thank you, Senator Bray. Men and women of the panel, those that are gathered in this room, I stand here today as a minister of the gospel of Jesus Christ, a senior pastor of Noblesville Baptist Church in Noblesville, Indiana, and a father of 9 children, the oldest 15 and the youngest 6 months, to bear witness to the testimony of Christ. The church is not the state, yet the church's role is to bear witness to the state. Jesus said, all authority in heaven and on earth had been given to him, and therefore Christians are to go and disciple the nations. God has appointed a day in which he will judge this world by one man, his Son, the Lord Jesus Christ. The offices you hold on this committee have been granted to you by Christ. He gives you the very breath you breathe in this moment. One day we will all stand before Christ and give an account for the stewardship of our lives, and for you, the stewardship of this office. The question before the committee is this: will you be innocent or guilty of enacting legislation that violates God's law, revealed in the Holy Scriptures? For God hates the shedding of innocent blood. Make no mistake, I know right where I stand. Our culture has rejected God, the lordship of his Son, Jesus Christ, natural law, and the special revelation of Scripture. The role of government, according to God, is to bear the sword of justice and enact just laws for the good of the people the government represents. But by what standard do we measure just law? My answer is this: the general equity of the testimony of Scripture.
I plead with you, men and women. I plead with you as a father, as a Hoosier, as a pastor. I plead with you, abolish abortion in the state of Indiana without exception. But don't stop there. Lead your constituents to repent of their sins and place their faith and trust in Jesus Christ, who is ready and willing to pardon anyone who comes to him in penitent faith. If the language of this bill isn't changed, innocent children will die. God's wrath will continue to be stored up against this state, and the Republican Party will lose many of its God-fearing constituents. Thank you.
Other questions? Senator Melton?
What was the last part? Well, I didn't get that. You said this is not. We're not talking from a political perspective, and you injected a political party in there. So I'm trying to. Can you unpack that for me a little bit?
My last paragraph?
Yes.
I'll read it again. If the language of the bill isn't changed, innocent children will die. God's wrath will continue to be stored up against us, and the Republican Party will lose many of its God-fearing constituents.
You know, I'll leave that alone, that part. You know, one of the things that I love about my faith in Christianity, when you go back into Genesis, and we are imperfect people, would you agree?
Yes. The Bible says we have all sinned, come short of the glory of God.
Amen. And God gave us all free will. He doesn't make us worship him. He doesn't make us do anything. Would you agree with that?
I'm a minister who operates out of the Calvinistic tradition, so I embrace both human responsibility and the ultimate sovereignty of God over all things.
As it relates to this bill, connect the dots for me, what you just said.
As it relates to this bill,
correct.
I stand here to encourage the men and women of this committee to change the language in such a way as to abolish the practice of abortion in the state of Indiana without exception.
Okay. All right, thank you.
Senator Taylor?
Thank you, Mr. Chairman. Pastor, thank you for your faith. It's kind of interesting. We have the same faith, but may have a different opinion on this issue, because I believe in Jesus Christ as well. But Jesus Christ also gave us guidance. You do believe that in his word, correct?
Yes, Jesus gave us many things that will guide us, including the idea that many will call him Lord, but in their works they will deny him.
Absolutely. As a matter of fact, some of his disciples did that very same thing before he was crucified, yet he still blessed them.
Upon their repentance, yes.
Yes, that's what it is. It's repentance, isn't it?
Yes, sir.
Okay, so when you talk to me about the Bible and this issue, where's it at? Where's the guidance that Jesus gives us in the Bible?
Scripture repeatedly speaks. We could go to in the book of Genesis chapter 9.
Most people do. Yeah.
Okay.
And it talks about
man being made in the image of God.
What does that tell us about this issue right here?
Believing that life begins its conception and rooting that in passages like Jeremiah 1:6, before I formed you in the belly, I knew you, Psalm 139, curiously wrought while you're in your mother's womb. Luke chapter 2, the babe leaped as Mary entered into the presence of Elizabeth.
And you're a pastor of a church, correct?
Yes, sir.
Do you have any members of your church who have divorced?
Yes, sir.
Are they members of your church?
Pardon?
Are they members of your church?
Yes, sir.
Have you read Matthew 19:9?
Yes, sir. Your point is?
You have according to what you literally, the literal meaning of Scripture, wouldn't those people be adulterers?
Not every person who has been through divorce has committed adultery, sir.
If they remarry before their wife dies, they have, according to Jesus.
We have different interpretations of that.
Okay. All right. I just want to make sure that, first of all, you are my brother, and I believe that. And I am your brother. And as my brother, the Jesus that I follow told me to love my brother, so I love you. I disagree with you, but I still love you. So I will never say that something bad's going to happen to you because you don't believe what I do. And I think that's the teaching with God that I was taught and what Jesus taught us all. Right. So before we, I was called, said I was going to die for my sins out there in the hallway. I don't think Jesus wanted us to judge anybody. As a matter of fact, he said that specifically.
But specifically,
so,
Scripture teaches that the spiritual man judges all things.
Yes, but not another man.
No.
And he says, if you are in my house, then all things and all people are good. Yeah. And I want to say to you, you are a good person. And this issue is going to be tough. It's something we're going to work on. But please, I want you as my brother to accept the fact that no matter what you believe is different than mine, we will all inherit the kingdom of God.
Sir, I will leave with this comment, but that goes completely against the teachings of Scripture. Only those who acknowledge Jesus Christ as Lord and Savior will be forgiven of their sins and receive the gift of eternal life.
Thank you, Pastor. Thank you for being here. Rabbi Aaron Spiegel. After that, Aaron Mullally, and then Joseph Bordka. So Rabbi Spiegel, Andrew Mullally, Joseph Bordka, and then Katie Blair. Rabbi, please.
Thank you, President Pro Tem Bray and members of the committee. That's a tough act to follow. I am Rabbi Aaron Spiegel, Senior Consultant for the Jewish Community Relations Council. I would like to read to you a statement we issued in partnership with the Indiana Board of Rabbis. The Indianapolis Jewish Community Relations Council and the Indiana Board of Rabbis strongly urge our representatives in the Indiana General Assembly to reconsider further restrictions on access to abortion in this state. Proposals that ban abortion, including cases of rape, incest, or undue risk to the pregnant woman, infringe on the separation of religion and state and prohibit members of the Jewish community from freely exercising deeply held religious principles. Jewish beliefs on when life begins are varied yet consistent in the view that a fetus is a part of the pregnant woman, not an independent human life. Under Jewish law, abortion is not only permissible in some circumstances, but is required, if necessary, to protect the physical and mental health of the pregnant woman. The Indianapolis JCRC and IBOR cannot support bans on abortion that would forbid access to life-saving care. Moreover, we believe that the physical and mental health of the pregnant woman are of the utmost importance, and we vigorously oppose any legislation that does not permit access to abortion at a minimum when Jewish law compels it. The Jewish concept of pikuach nefesh, preservation of life, is paramount. Judaism holds that all life is sacred, and while a fetus has the potential for life, such potential never supersedes the life of the pregnant woman. The Jewish community regards any absolute ban on abortion a violation of our rights as Americans to freely exercise our religion and the imposition of one group's religious beliefs on all. The Indianapolis JCRC and IBOR will remain steadfast advocates on behalf of our community on issues of human rights and religious freedom. Mr. Chairman, Senators, I'll reiterate that banning abortion, even with exceptions, is a direct violation of the First Amendment's guarantee of religious liberty that ensures that laws and government practice neither promote religion nor interfere with its free exercise. Banning abortion without exceptions is also using the religious beliefs of one faith to dictate laws to another. I believe religious liberty is sacrosanct. Using religion as the basis of law is dangerous, but if you use one religion as a determiner, you must include all others to be compliant with the Constitution. Thank you for your attention.
Rabbi, thank you, and I commend you on your timing. That was exactly 3 minutes, so well done. Are there questions for Rabbi Spiegel? Senator Melton.
I don't have a question, just a comment. I want to thank you for your testimony. That was probably one of the most clear and concise testimonies I've heard that kind of explains it from a religious perspective. I would love if you can share that with us if it's at all possible.
Happy to. Thank you.
Thank you.
Rabbi, thank you.
Thank you.
Andrew Mullally. After that, Joseph Bordka, and then Katie Blair, and then Meredith Deem. Mr. Mullally, go ahead.
Hello, thank you, Chairman Bray and the members of the committee. My name is Dr. Andrew Mullally. I didn't know you could put doctor on the screen there. And I'm testifying in opposition to Senate Bill 1. I'm a board-certified family medicine physician in Fort Wayne, and after reviewing the bill as it is written, I thought it was important for me to reschedule my patients and come and speak with you today. There are two particularly egregious shortcomings about which I'd like to speak. First, the bill speaks about an exception for the preborn child with an irremediable medical condition that is incompatible with sustained life outside of the womb, quote unquote. This wording is confusing and vague as a doctor. It is also inconsistent with our state's current law banning abortions due to disability. This is a step backward and sends a clear message to disabled Hoosiers that their life is not worth living. Additionally, it should be noted that physicians are very bad at predicting the future of a person's health. Every one of you likely knows multiple people who are given only so many months to live and are still alive years later. Furthermore, in reference to pregnancy, even our most powerful and accurate DNA prenatal blood testing is imperfect. Recently, I was caring for a couple who, based on that very blood test, were expecting a baby girl, and they were shocked when that test could be wrong and they delivered a baby boy. We cannot predict the future. Saying that we can accurately enough to kill our preborn patient because of the risk of a potential disability is a lie and a terrible insult to those who live with disabilities. Secondly, this bill has no teeth, period. As a physician, I support clear and severe penalties for those physicians who perform abortion in defiance to the rule of law. At a minimum, this must include mandatory suspension of licensure and jail time. Just as a physician seeks to care for both the pregnant woman and the preborn child, so should the state of Indiana. If a physician kills their patient on purpose, they should do jail time. I'm really surprised this is so controversial. Deferring punishment of physicians performing illegal abortions to the discretion of the licensing board is inadequate. This is an abdication of the duty of this body to ensure that their laws that you make will actually be followed. What if the medical licensing board disagrees with banning abortion? I am not confident that this sideways enforcement mechanism would uphold the rule of law and protect the state's interest in the life of the preborn child.
30 seconds.
The state of Indiana does have a duty to protect life, and this bill does not adequately do so. Both these holes need to be filled before this bill is voted on, and I oppose Senate Bill 1 as written. And I'm happy to answer any questions.
Thank you, Dr. Mullally. Are there any questions from the committee? Senator Charbonneau?
Thank you, Mr. Chairman. Just two quick questions, really. You're a family physician?
That's correct.
Are you speaking as an individual or representing the Association of Family Physicians?
I'm speaking on behalf of myself and my colleagues who are busy caring for patients and can't come deal with this chaos, and for the people who do not feel safe to testify because of retaliation by their employers, of which there are many.
But you're not speaking for an association, or are you?
No, I'm not speaking for an association.
Senator Taylor?
Thank you, Mr. Chairman. So, Doctor, you practice family medicine?
That's correct.
So, if you had a patient who had that got pregnant, would you deliver the child?
I have delivered. I've recently stopped delivering babies.
Well, hold on a second. You said you have delivered?
Yes.
Was that in an emergency situation?
No, it's in part of my training and my practice.
Oh,
it's actually
okay.
a lot of hard work, and so I've recently given it up to get more sleep, and so I can do things like this.
Yeah, imagine if you were the woman. But here's the deal. The question I have for you ultimately is, when you make the reference that you're here to stop, do you abide by the current law right now?
I'm sorry?
Do you abide by what the law is right now in Indiana?
Do I abide?
Yes. Do you practice medicine in Indiana? I guess, let me start over. Do you practice medicine in Indiana? And you have a license, correct?
Yes,
So
and a board certification for those who care.
Right, and a board certification. So you abide by Indiana's laws right now?
I do.
So if a woman came to you who was pregnant and asked for an abortion provider, you would provide it to her?
I don't perform abortions.
I didn't say you performed it. Maybe you didn't understand my question. Would you refer her under current law?
No, I would not. Abortion is a bad thing. I'm against it.
Thank you.
As a doctor.
Dr. Maloli, thank you. Next on our list, Joseph Bordka, Katie Blair, Meredith Deem, and then Dr. Gregory Miller. So Joseph Bordka, Katie Blair, Meredith Deem, and Dr. Gregory Miller. Mr. Bordka, go ahead.
Thank you, Mr. Chairman. Committee members, thank you for giving me the opportunity to testify here. I vehemently support this bill. When I was a young medical student, I couldn't believe my luck when I learned that I could pay off my mountains of student debt by convincing mothers that their babies are just clumps of cells so that I can make a profit by killing their children. It was a horrible day when the Dobbs decision came out. With a Republican supermajority in Indiana, I thought I'd have to close up shop for good until I read about SB1. SB1 strikes the perfect balance between claiming to do away with abortion while leaving enough leeway for my lawyers to protect me. I was so excited to hear that this bill would let me continue to profit off of vulnerable women with nothing more than a piece of paper signed by a woman claiming she was raped. It's such a relief that the GOP was able to get rid of those troublemakers, John Jacob and Kurt Nisley. That was $1 million well spent, if you ask me. Their bill surely would have meant the end of my trade. Instead, we got this wonderful bill, which will triple my business by giving me all the clients from Ohio and Kentucky. I might just have to donate to the HRCC. I'll ask my accountant if I can write it off under sales commission. Thank you so much, GOP. I'll make an extra sacrifice to Moloch for you when I get back to the office. Thank you very much. I will not be taking questions at this time.
Katie Blair.
Hello. Hello. Senator Bray and members of the Senate Rules and Legislative Procedures Committee. The ACLU of Indiana rises today to express our opposition to Senate Bill 1. I've been at the ACLU of Indiana for nearly 9 years and have been lobbying lawmakers for around 6 of those. Every year, you pass new, unnecessary restrictions on a woman's access to safe and legal abortion. While I'm disappointed that I am here today fighting against a ban on abortion in the Hoosier state, I'm sadly not surprised. The thousands of Hoosiers that have come out to the State House today, that are here rallying outside that you can hear so well, they've come out to the State House today because you are finally taking your shot at eliminating a crucial aspect of reproductive health care and reducing over half of Hoosiers to second-class citizens. The fight for reproductive rights is why I do advocacy work. I do this work because a member of my family got pregnant in high school and had to make a hard decision on what their future would look like. I do this work for my girlfriends who have had abortions, who jumped through the hoops that this legislative body put before them in order to live their lives on their own terms. I do this for the enormous number of brave women who have come forward to tell their own, sometimes difficult stories about their abortions. And I do this work because I was raped at 19 by a coworker at my summer job waiting tables. I was away from home in a new city without friends and family to take care of me and give me the resources I so desperately needed. I was terrified that I would become pregnant. Whew. It took a lot to share that with all of you, but I believe that this place that we're in right now, today, is because women have been silent out of fear of backlash and stigmatization. These deeply private, personal, and unique decisions should be made by women in consultation with their doctors. What is right for one family might not be right for another. From its very inception, the Indiana Constitution has contained the right to privacy. Implicit in this right is the right of a woman and her doctor to make medical decisions regarding their reproductive health. Whether members of the Indiana General Assembly personally agree with abortion access or not, it is not up to the government to make these decisions for Hoosiers. Forcing someone to carry a pregnancy against their will has life-altering consequences, including forcing them to endure serious health risks from continued pregnancy and childbirth, making it harder to escape poverty, derailing their education and career plans, and making it more difficult to leave an abusive partner. An abortion ban in Indiana would harm all of us. I encourage members of this committee to vote no on Senate Bill 1. No one should be forced to carry a pregnancy against their will, period.
Thank you, Ms. Blair. Other questions from the committee? Thank you very much.
Thank you, thank you.
Next to testify is Meredith Deem. Up on deck after that is Dr. Gregory Miller, and then Brian Schrank and Ariel Reen. So Meredith Deem, Dr. Gregory Miller, Brian Schrank, and Ariel Reen. Ms. Deem, go ahead.
Good afternoon, President Bray and members of the Rules Committee. My name is Meredith Deem, and I am a lifelong citizen and resident of Indiana. I received my bachelor's degree in English literature from Indiana University and my master's in philanthropic studies from IUPUI. I now work in victim advocacy, specifically for those who have suffered at the hands of sex crimes and dating violence, domestic violence. I am here to voice my opposition to the proposed legislation on abortion, Senate Bill 1. The issue of abortion has become, over the last several decades, a politically loaded one. And at the same time, it remains intrinsically a deeply personal issue, specifically for those of us whose bodies happen to be born with childbearing capabilities. It is difficult to appropriately articulate the surrealness of the situation in which we find ourselves. In my 32 years as an American citizen, never did I believe I would one day have to plead my case to my own state officials and to my fellow Hoosiers that I should have the right to be the sole determiner of what happens to my body, why the state government should not have the right to decide if or when I become a mother, and why my rights and my life as a fully formed, self-realized human being should be more protected than the potential inchoate life of an unborn fetus. Is my life truly only worth what the sum of my parts can create? The implications of this legislation extend, of course, far beyond myself. They concern every Hoosier and our state as a whole. If enacted, it is understood that this legislation will give rise to an increase in unwanted pregnancies and unwanted births. The reasons for why a pregnancy may be considered unwanted are varied, from health or medical reasons to financial reasons to personal and mental emotional reasons. The truth is, the reasons themselves don't actually matter. What matters is that more unwanted pregnancies lead to more unwanted children, and the more burden will be put on our already strained institutions across the state, from our hospitals to our schools to our courts and Department of Child Services. But most importantly, however, it will place more hardship on our citizens, especially young girls and teens, and on Hoosier families who simply may not be equipped to care for a child or an additional child. To me, this begs the question, why would we insist that any child ever be born unwanted? We also see in this proposed bill a few narrow exemptions in which abortions are permissible.
30 seconds.
The first is if the abortion is necessary to prevent a substantial permanent impairment of the life to the mother. It has already become clear that there is serious concern in the medical community over the bill's lack of clarity around what constitutes life impairing. We have the third highest maternal mortality rate in the nation, and this is only going to add more unnecessary, completely preventable injury, trauma, and deaths for women in Indiana. The second exemption permits an abortion if the pregnancy is the result of rape or incest. This is fairly common and universally there is consensus on this of both sides, because everyone can agree that it would be cruel to force a victim of rape or incest to endure an unwanted pregnancy and give birth to their rapist or abuser's child. The idea that it wasn't the victim's choice to have sex and so they shouldn't have to bear that burden and responsibility for the life that was conceived from it. And yet is it not equally cruel and barbaric to force any human being to sacrifice their body to carry an unwanted pregnancy, undergo massive physical, mental, and emotional upheaval, and force them to give birth to an unwanted child that is then dependent on them for every physical, emotional, and financial need for years to come? Why is it any different? Why is one abortion justified and the other is not, if all life is sacred? It really comes down to choice, ironically. Right now, you are saying if you choose to have sex and end up pregnant, then that is just your responsibility. That is the lot your life has taken, and you don't get a say in it. There is no room for error. Your body is not your own, and you don't have your own self-determination. The underlying of this bill is not supported by reason or science or even humanitarianism.
Ms. Deem, that's 3 minutes. Thank you. Other questions for Ms. Deem? Thank you for your testimony. Don't see Dr. Gregory Miller here. Dr. Gregory Miller is next on the list, then Brian Schrank, then Ariel Ream. Are any of those folks here, sir? What's your name?
Brian Schrank.
Brian Schrank, come on up. Thank you.
Great. Good afternoon, members of the Senate Committee. My name is Brian Schrank, and I am a minister of the gospel of Jesus Christ. I am against SB1, as everyone else has been, I believe. I don't think one person who's testified is in support of the bill. I find that fascinating. Now, I minister on the streets as a sidewalk counselor at local abortion clinics around the state, offering men and women help and the hope of the gospel of Jesus Christ. I've seen firsthand how Indiana has become an abortion tourism state, with many men and women coming from Ohio and Kentucky to murder their children since Roe was overturned. I'm here to speak to you directly, senators, about your responsibility before the Lord. According to Romans 13, elected officials are ministers of God, and your primary purpose is to punish evildoers and protect good citizens. Now, I want you to recall the constitutional oath that you swore before your family, before the Indiana Supreme Court, and before the Lord. Now, you repeated these 4 words at the very end of your oath with perhaps your left hand on the Bible and your right hand raised. What did you say? You said, "So help me God." The oath you took was not only before the people whom you are to represent, but before the Lord Jesus Christ, to whom one day you will give an account as to how you've governed. Like pastors of local churches, you will have a higher standard when you stand before your Creator for being an elected official. And don't forget, He's the one who puts you there ultimately. Now, with that being said, I want to instruct you as to why SB1 falls woefully short of God's law and standard when it comes to governing His image bearers. God hates this abortion regulation bill. And why is this? Well, the prophet Isaiah tells us in Isaiah chapter 10, verses 1 and 2. This is the word of the Lord. He says, "Woe to those who decree iniquitous decrees and the writers who keep writing oppression, to turn aside the needy from justice and to rob the poor of my people of their right." SB1 is an iniquitous decree, for this law will continue to persecute and subjugate the most innocent in our state, the preborn. Now, if you believe that all children are human beings from conception,
30 seconds.
as God's word teaches, if you believe that all human life is valuable, and if you profess to be a follower of Jesus Christ, you must establish justice and amend this terrible bill with the language of Representative Nisley and Jacobs, the Life Bill, which is the only bill that will give these preborn children in our state constitutional rights and protections. Anything less is an abomination to the Lord. Now, I would like to close with this final warning from the prophet Ezekiel. He says this, "Therefore, as I live, declares the Lord, I will prepare you for blood, and blood shall pursue you, because you did not hate bloodshed. Therefore, blood shall pursue you. Violence in the womb by abortion gives birth to violence in our streets. And if you continue to permit the slaughter of the most innocent in the womb, things will get much worse in Indiana. I'm calling on you, senators, to fear God more than you fear the left and to abolish this evil once and for all. In Jesus' name. I'm finished.
Other questions? Senator Melton.
Thank you, Mr. Chair. Earlier in your comments, you mentioned that Indiana is turning into a tourism state.
Yes, abortion tourism state, correct.
And you said Ohio, what other state?
Yes, Ohio has a heartbeat bill that was enacted right after Roe.
What other state?
6 weeks in Kentucky. Kentucky has a complete ban that's being challenged in the courts, but for the first 2 weeks.
So that's
yes.
not the question I'm asking. So how are you tracking this?
I'm at the abortion clinics and I witnessed this firsthand. The numbers at the 12th and Arlington Abortion Clinic, the Women's Med Center, have doubled or tripled in the last month or so.
Are you tracking and logging this information? Are you watching? How are you doing this? What's your process?
Yeah, we count the numbers of men and women who go in each day. Correct.
What are the numbers?
The numbers, anywhere between 75 a day, between 50 and 75 a day. Yep.
And out of that 50 to 75 a day,
about half of them have been from Ohio and Kentucky since Roe was overturned.
So you also said, just from an elected official perspective, so help me God, and when we swore and took an oath, from my perspective, when I say so help me God, I'm asking God to help me make decisions as we sit and listen to folks that come and testify, and so we can make sound judgment and sound decisions on how we individually will vote, and it will have a collective impact on the masses. So I just wanted to make sure that the public is understanding that. And the questions that we're asking, and this is for future folks that's coming up, don't take this as debate or antagonistic. I think we're looking for real, genuine responses and answers so we can hear from Hoosiers.
Yeah, and I appreciate the questions from the Democratic side. I would like to hear questions from the Republican side. It's been crickets. Guys, you're the pro-life legislators who've been elected for the last 30, 40 years who said you're going to ban abortion, and I don't think there's been one question from a Republican representative. I didn't mean to interrupt your point, sir, but thank you guys for the questions, and I'm being sincere about that. Regarding your so help me God, that was related to your duty to uphold the Indiana Constitution. So I think that's important to remind us, and there's nowhere in the Indiana Constitution that says you can deprive a person of their life, and there's nothing in the Indiana Constitution that says abortion is legal. Yes, Senator?
No, I think okay. I'll let the chairman.
Senator Taylor, do you have a question?
Yeah, I didn't know if my colleague was finished. Oh, okay. So, you heard my testimony with your colleague before. So you're a pastor?
I'm a minister. I minister on the street, so I'm not specifically a pastor, more so an evangelist.
So you're into saving souls?
Yes, I'm here to bring the good news of Jesus Christ, that he can set the captives free and he can save anyone who calls upon his name and repents and believes.
And I'm glad we agree on that. That's why I love having these questions to come up. You read about the 10-year-old child that came here from Ohio because she was raped. Is that what you mean by Indiana becoming a tourism place?
I didn't see her specifically, but I'm just attesting to the men and women that I've witnessed that have come from Ohio. Now, here's the thing. The abortion clinic on the east side of Indianapolis is actually owned by abortionists out of Dayton, Ohio. So any women after 6 weeks, I'm just letting you know that they're referring women to come to Indiana. So that's what's happening. That's why we've seen the increase in traffic.
You would say that young lady was supposed to have that baby?
Well, here's what I think we should say. I think rape should be a capital punishment, and that person should be executed, first off. Perhaps if we had stiffer, let me address you legislators related to this. Our rape laws are so weak that you, in essence, they incentivize these crimes.
Penalties.
Well, sir,
I asked you about the bill that we're talking about is abortion. Should that child have to have that child?
So God is the giver and taker of life. And God gave that young girl life, despite a terrible circumstance, and you don't punish the child for the sin of the father. Two wrongs don't make a right.
Do you believe, sir, that physically a 10-year-old girl's body could physically have a baby?
Well, I can't speak to that. I'm not a doctor. I wouldn't know.
Well, here, let me help you.
Yeah.
There's a separation that happens with the hips of a mother when she delivers. Are you familiar with that?
The separation? No, please elaborate.
Well, it has to happen in order to, unless you have a C-section,
Okay.
for the baby to come down the birth canal. Are you familiar with that?
Sure, I have 4 children. Yes.
Okay, so do you think that young girl's pelvic area could separate long enough, wide enough for her to have a baby come through the canal?
Again, that's not a question I can answer. So that's why there's an option. Thank God for medical technology and emergency C-section that could happen.
I'm glad that she could have a C-section.
Yeah.
But I do want to get back to what you do.
Yes.
How do you know all those people showing up from Ohio are going in and getting an abortion?
Because the clinic that I'm at specifically, that's all they do. It's not a Planned Parenthood. They don't offer many different services. It's just an abortion clinic.
So they walk in and say, hey, I'm going in to get an abortion?
Absolutely, yes.
They tell you that?
Yes, Senator, I would love for you to join us. I will get your contact information, and you can see firsthand of the men and women who go in there. And
actually, we've met before. I've seen you. Okay. I saw you up at the 86th and Georgetown.
Yep.
And you weren't asking them. You were telling them they were killing kids. Okay. So don't do that.
You've seen me specifically?
Yes, sir.
Okay.
I saw you.
You may have saw me preaching in the State House quite a bit because that's what I do.
But
perhaps
listen,
you're mixing me up on 86.
Let's get back to the abortion bill. I just really want to, and you are my brother, as I told your colleague before, you're my brother in Christ. And when Christ, even Jesus, if you believe in what Jesus did, he said to the people that you are not perfect. You're going to make mistakes, but through your faith in me and your repentance to our Father, you will inherit the kingdom of heaven.
And that's what we tell the women.
Let me finish.
At the abortion clinic.
Let me finish. When you tell people, because they vote a certain way on a piece of legislation, that they're going to go to hell or they're going to burn, that leaves out the fact that they can repent and they can be forgiven. And that's what Jesus wanted us to know, that we are going to make mistakes. I'm not going to be perfect with you, sir. I might not even agree with half the things that you say, but as long as I believe in Lord Jesus Christ, and he is the middle, front, and back of my life, I will inherit the kingdom of heaven. So I'm offended when you come up here and say about burning in hell, because we both have the same route to hell, and that is if we don't love Jesus and believe in God, and I believe in that. So I was nice to the guy before. I'm a little more angry with you when you start talking about people. If somebody else from your group gets up and says that again, I'm not going to be so nice. Don't burn people, because you do not make that decision.
Yeah. So because I had the accusation brought against me that I said this specifically, I didn't say anyone was burning in hell. What I was saying is that God has appointed you as a high calling. You are ministers of God. In my opinion, you're up there with pastors, and you're going to stand and give an account before the Lord to how you voted. And this is a very serious task, and that's what I'm here to remind you about. So, any other questions? Thank you.
Ariel Ream. First of all, Ms. Ream, wait a moment. Is Dr. Gregory Miller here? I called him earlier, have not seen him come up. Dr. Gregory Miller, if you're out there, you can come to the front to testify here when you get here. Ariel Ream first. After that, Gray Lasesny and Dr. Amy Caldwell. Go ahead, ma'am.
Thank you, Mr. Chairman and committee, for holding testimony and hearing me today. My name is Ariel Ream, and I live in Marion County, and I am a constituent of Senator Kreider in District 28. My husband and I are currently in the middle of a fertility battle and working to conceive a family through IVF, which some of the people that have stood here today have called an abomination. I know that this important bill will likely impact my ability to have a baby. I have battled lupus and other autoimmune diseases for years, and I'm at very high risk for a stillbirth or a miscarriage. My husband is so terrified of the vague language in this Senate Bill 1 that he's asked that we not continue with our fertility treatments. I recognize my privilege and my stability of my job and my health insurance and my support, that I know if I need an abortion, I have the ability to leave this state. The language in this bill is simply too vague. Who gets to decide when my life is truly at risk? Who gets to decide when the abnormalities of a fetus are fatal enough? Is it this committee? Or is it the people that stand outside? Is it the people that sit over here? Is it my OB? Is it me? Or is it a doctor in an ER? When is the line enough, and how many women get to die before it gets drawn? I do not understand, nor will I ever comprehend, how this state claims to be pro-life when they won't mandate coverage for maternal care and you won't prioritize the health of pregnant Hoosiers. State Bill 1 puts my rights at risk to build my family. Even though I'm desperately trying to build a family and have a baby, I'm fighting like hell to keep the rights of my fellow women and people around me legal. It is not my right, it is not anyone else's rights, or it is not the rights of this state to tell anybody what they can and cannot do with their body. Please consider doing what's right and protecting Hoosier women and their bodily autonomy and their rights to make their own medical decisions. I'll end by saying I am pro-choice, but this does not mean that I am not pro-life. I am pro-woman. And I kindly ask that you consider the decisions and the impacts of them when you make your decisions today or tomorrow. Thank you so much for your time.
Thank you, Ms. Ream. Are there questions from the committee? Senator Yoder?
Thank you, Mr. Chairman. Thank you. Yeah, it was so brave.
Ms. Yoder, if I could, just to keep things moving, I apologize for the interruption, but after Ms. Ream is Gray Lasesny and then Dr. Amy Caldwell. I don't see them in line, so hopefully they'll move forward. Please go ahead. I'm sorry.
No problem. I just want to say you're so brave. I wanted clarification. So you are going through the IVF process right now, and your husband is concerned that the language in SB1 is not clear around the feticide language. Can you just repeat that? Because I share that concern as well.
Yeah, absolutely. I'll say this. I've never seen my husband cry, with the exception of when the Cubs won the World Series, the day we got married, and the day that the Supreme Court decision was made on Roe. He walked in my office and he had tears in his eyes. And he said, "We can't continue on this battle because I'm not sure you'll make it." I can't tell you what that means to me when my husband says to me, "I'm scared to have a baby through IVF because I don't know if he'll live and I don't know if I can get you the care you need in time to survive it." So when we read the language, and I printed that bill out and I redlined it up and I marked it up and I highlighted areas, it simply is just too vague. When is enough? When am I hemorrhaging enough to be able to get care? What doctor is not going to be scared, as we've heard today, to not lose their license to give me the care that I need? That's terrifying. That's scary enough for him to say, maybe we should take a pause until this gets sorted out. IVF is a very expensive process, something that's not covered in our state. It's not mandated coverage in our state. It is in other states, but it's not here. We've spent many thousands of dollars trying to succeed in having a child. But part of that is potentially having a miscarriage and potentially hemorrhaging and potentially losing embryos and things like that. It can become very scary for women who are in my position to say, let's take this risk. Let's potentially have a really scary time when we don't know if we go to the ER, if that doctor's going to be scared enough to put their license on the line for me.
Well, thank you for your courage, to you and your husband.
Thank you.
I appreciate it very much.
Thank you.
Are there further questions? Ms. Ream, thank you very much.
Thank you.
Gray Lasesny.
Good afternoon. I am the Reverend Gray Lassane, and I serve as the Dean of Christ Church Cathedral, located just 2 blocks here from the State House on Monument Circle. Our congregation is part of a wider network of Episcopal churches and people of Christian faith from across the great state of Indiana, from South Bend to Jeffersonville, Evansville to Gary. As an ordained Christian clergy person and as a person of deep Christian faith, I come to you today asking that the Senate take no further action on Senate Bill 1. This legislation will harm the women and girls and pregnant people in my congregation, will endanger the lives of women who live in our downtown neighborhood, and will threaten the health and safety of pregnant people across the Hoosier State. As a pastor and a priest for more than 21 years, I have, on several occasions, counseled and supported pregnant people who, for a variety of very legitimate and moral reasons, have needed to end their pregnancies. I can say that in each case, the women and pregnant people that I counseled and supported made those decisions prayerfully, reverently, and after much soul-searching and conversation with their families, their medical providers, and with me, their pastor. Our conversations weighed many moral goods and were made in consultation with friends, family, and my parishioners' medical providers. Today, Senators, I am asking you to give Hoosier women and pregnant people the dignity and respect to make these difficult decisions with their doctors, their families, and their communities of faith. You may be surprised to hear a Christian clergy person asking you to take no further action on this bill, but I want you to know that there are many faithful Christians and people of many different faiths in the Hoosier State who believe that equitable access to women's health care, including women's reproductive health care, is an integral part of a woman's struggle to assert her dignity and worth as a human being. If you pass this harmful legislation, you will be endangering the lives of young teenagers in my church's youth group who may self-harm if they are not able to be open and honest with their doctors. You will endanger the lives of pregnant people in my downtown neighborhood experiencing homelessness who would have no ability to travel out of state to obtain adequate reproductive health care. And you would endanger the lives of pregnant people sitting in my pews who face high-risk pregnancies where local doctors may refuse to care for them for fear of being prosecuted, to name only a few. As one of many pastors and priests and religious representatives from many different traditions, I, along with other clergy, will continue to walk the sacred and vulnerable road with the pregnant people I serve when difficult reproductive health care decisions need to be made. We will continue to counsel and support them, and if you pass this harmful legislation, we will help them obtain appropriate care out of state. However, what I'm asking of you today is that you would please leave these difficult decisions to pregnant people and their medical providers here in their home state. When they seek our counsel, our faith communities will support and guide and nurture them. But please, I ask you, leave these decisions up to them. Thank you.
Thank you, Pastor. Are there questions for Pastor Senator Taylor? Go ahead.
Yes, thank you, Pastor. We've heard from many faiths today, but you happen to be a Christian, and you've heard the testimony of some of the other Christians and their opinions about what we're doing. From your understanding of what Jesus taught us all, how does abortion fit into that?
So Jesus' primary commandment was to love your neighbor as yourself. And for us, this is all about loving our neighbors to provide them equal access to equitable health care and letting God and God's grace and mercy sort out the rest.
So let me, so just so I make sure I understand, you talk about access to health care, and I want the public to understand what that means. That means that that clinics provide more than abortion services at those clinics, don't they?
This is about a relationship between a pregnant person and their doctor, their primary physician.
So a young lady might be able to get pills to make her seem like she's ovulating when she's not, which is what the pill...
I'm not a medical provider, but okay. I trust the sacred relationship between a doctor and a doctor's patient.
A woman, for example, who may be on dialysis and knows that if she's at childbearing years, if she were to get pregnant,
it could be very dangerous.
It would be very dangerous, and she would have to terminate or stop her dialysis treatment, might get an IUD from that same clinic.
Yes. And we would be in support of that, Senator.
Yes, okay. I just wanted to make sure, because sometimes, those of us in faith, we think monolithically, and I just wanted to make sure that as someone who believes in Jesus Christ and is a Christian, consider himself a Christian, I know that there's circumstances where Jesus would want us to respect people like he wanted us to, we want them to respect us. So thank you for your testimony.
Senator.
Pastor, thank you very much.
Thank you.
Appreciate you being here. Dr. Caldwell. After Dr. Caldwell, we have Matthew Aaron, David Zimba, and Dr. Tyler Johnson. So after Dr. Caldwell, Matthew Aaron, David Zimba, and Dr. Tyler Johnson. Go ahead, please. Thank you for being here.
Yeah, no, thank you for having me. My name is Amy Caldwell, and I am a practicing obstetrician and gynecologist here in the Indianapolis area. I'm here today to represent myself, my patients, and the Indiana section of the American College of Obstetrics and Gynecology. My job is to provide my patients with the information they need to make important decisions about their health and well-being. My job is to provide a place of compassion and safety such that they can make the best decisions for themselves and their families. The American College of Obstetrics and Gynecology, the leading professional organization in our field with over 60,000 physician members, attests that individuals seeking abortion must be afforded privacy, dignity, respect, and support, and to be able to make their medical decisions without undue interference by outside parties. Every major medical professional organization in the country, not only ACOG, but also the American Medical Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Society of Reproductive Medicine, the list goes on, recognize that the integrity of the physician-patient relationship, the fundamental medical principle of bodily autonomy for all patients, and the inherent duty we have to take care of all patients according to evidence-based medicine and within the accepted standards of medical care. My primary objective today in testifying is to relay that abortion is common, it is safe, and that all of the proposed restrictions in Senate Bill 1 are unnecessary and harmful. 1 in 4 people capable of pregnancy will have an abortion in their lifetime. These are mothers, grandmothers, Christians, Muslims, women of all races and nationalities, and all socioeconomic groups. The people accessing abortion care are varied and as diverse as our country itself, but the one thing they have in common is the right to make decisions about their life and their bodies. That decision, a complex and complicated decision, is not the black and white issue abortion bans try to make it out to be. What we do know about Hoosiers and abortion is that fewer than 1% take place in the second trimester, that the vast majority of abortions in our state occur at fewer than 8 weeks when a pregnancy is still in the embryonic phase. And we know that at this stage, abortion is approximately 14 times safer than having a normal childbirth. The evidence is clear. A young woman is 14 times more likely to die if she continues a pregnancy. Our goal is to reduce the number of abortions. The solution is not to ban them. The solution is to increase access to comprehensive sex education and contraception. But even then, there is no way to avoid the unpredictable. We know that abortion bans will delay care, causing more women to require abortion later in their pregnancies, causing them to have to travel further out of state, taking time away from their families and their jobs. These laws are unclear and medicine is nuanced. My colleagues are scared to do their job.
You can wrap up if you would, please, but that's 3 minutes.
Oh, okay.
Yeah.
My colleagues are fearful to do their jobs, fearful of being criminalized, and fearful for criminalizing our patients. The most vulnerable populations, the people that we've dedicated our lives to taking care of, are the ones that are due to suffer the most under these restrictions. And the people with the least resources will be forced to continue their pregnancies. Again, we cannot possibly anticipate every exception or scenario where abortion would be the appropriate medical option to offer. Professionalism is setting aside my personal beliefs to take care of the patient in front of me, and that happens every day. That happens when I counsel a patient on whether or not to continue care for their terminal cancer, on whether or not they want to undergo a potentially risky procedure that may end up limiting their life, or whether or not they want to resuscitate their 23-week-old baby. My job is to provide them with information and a safe place to consider those options and empower them to make the best decision that is for their family.
Thank you, Dr. Caldwell. Are there questions of Dr. Caldwell? Senator Melton?
Thank you, Mr. Chair. Thank you for your testimony. When you read the bill and you talk to your colleagues, what is this, the way it's written right now, how would this impact you if it becomes law? And are your colleagues concerned about the future of healthcare in the state of Indiana in that regards overall?
Absolutely. I, provide family planning services, including abortion care at a major academic medical institution. And I've had colleagues reach out to me from every possible department in the hospital asking about what this means for their patient on dialysis because they're end-stage renal failure, on their patient who is waiting for a heart transplant, on their patient who, is desperately wanting to be a mother and seeking IVF services. And if there is a complication or an anomaly that comes up, what does that mean? I know my emergency medicine colleagues are incredibly fearful of any potential criminalization or legal ramifications that they could face when intervening in an appropriate medical fashion when a patient presents, for example, with vaginal bleeding in the first trimester.
Could that second half of the fear that you just mentioned impact the workforce, future healthcare professionals in the state?
Oh, certainly, yes. We're in the process of reviewing applications for our residency classes and recruiting, physicians to Indiana. So I think something like 80% of counties in the state do not have an OBGYN, and my colleagues do not want to move to places where they are afraid of being criminalized.
Great, thank you.
Senator Lennon.
Thank you, Mr. Chair. Doctor, have you read over the definition of reasonable medical judgment in the bill?
I have, yes.
Do you have a comment on that? Or let me just ask you this. Do you think this, is it understandable? Will physicians understand what constitutes reasonable medical judgment underneath this definition?
I think that it can vary. I am fortunate enough to be at an institution with a very large legal department with whom, I am in personal contact. I think in smaller community settings where those resources are not available, physicians are going to be in a much tighter spot. And honestly, there is some nuance and variation between, how one physician kind of perceives and looks at objective clinical data and how the next. And so, that is the art of medicine. It is not a black and white practice.
Well, I asked that question because I am a lawyer. I don't have expertise in medical law, but this idea of a reasonably prudent physician who is knowledgeable about the treatment possibilities concerning medical conditions involved. I'm trying to envision that mythical, reasonably prudent physician, especially in light of the fact that as a person, I had a condition and I went to 3 doctors and I got 3 different opinions. And the first one was, I think you need this procedure, but you might want to get a second opinion. The second opinion was, I don't know if you need the procedure or not. And the third opinion was, you absolutely don't need this procedure. And that is not uncommon in the medical field, is it?
No, I don't think so. There are very few.
So which of those 3 mythical, reasonably prudent physicians should you go with in that case?
That's an excellent question, and I don't know that I have the answer to that.
And then I also wonder, in this language here about the affidavit of rape or incest, it says that you may consider that affidavit. What does that mean to you? Are you supposed to conduct some sort of an independent investigation as to whether or not there was rape or incest, but you can consider the affidavit? But, we all know that women make up all types of things, I guess, so you can't rely. Why doesn't that just simply say that you can rely on the affidavit? And what else could you do in that circumstance? Okay, thank you.
I think that's a question for the lawyers.
Dr. Caldwell, thank you. Appreciate you being here. Is Dr. Miller here yet? Dr. Gregory Miller? Not seeing Dr. Miller. Matthew Aaron? Matthew Aaron, come on up. After Matthew Aaron, we've got David Zimba, Dr. Tyler Johnson. Matthew Aaron, David Zimba, Dr. Tyler Johnson. And then Peter Breen. Peter Breen would be next after that. Go ahead, please.
All right, friends. Senator Mark Mesmer, my senator. I'm deeply disappointed with the purpose of SB1. It is never good to murder a child for the crimes. It is never good to murder a child for the crimes of a father. The deception and hidden agenda of SB1 hiding behind for the health of a mother to allow a subjective physician to kill a human, even up until partial birth abortion, is murder. The Almighty King, Jesus Christ, has ordained government to praise the good and punish the wicked, and to protect the innocent, according to Romans 13. This bill does the exact opposite and praises the wicked and murders the innocent. The blood of these children will cling to your hands forever. There must be complete protection from conception without exception. I'd like to share with you Psalm 82 and the Word of God. It says, God standeth in the congregation of the mighty. He judgeth among the gods. How long will you judge unjustly and accept the persons of the wicked, Selah? How long will he judge unjustly and accept the persons of the wicked? Defend the poor and fatherless. Do justice to the afflicted and needy. Deliver the poor and needy. Rid them out of the hand of the wicked. They know not, neither will they understand. They walk on in darkness. All the foundations of the earth are out of course. I have said, ye are gods, and all of you are the children of the Most High. But ye shall die like men and fall like one of the princes. Arise, O God, judge the earth, for thou shalt inherit all nations. Those two verses, defend the poor and fatherless. Do justice to the afflicted and needy. Deliver the poor and needy. Rid them out of the hand of the wicked. It is your duty, it is our duty, to protect and save the poor and needy from death. And if you will not, according to the last verse where it says, rise, O God, judge the earth, God will judge you, and God will judge our state, the state of Indiana. The Psalm says, the wicked shall be turned into hell, and all the nations that forget God. I ask, please repent, do justice, and stop the murdering of the preborn. Thank you.
Thank you. Other questions of the witness? Senator Taylor, do you have a question?
Yes, I do, Mr. Chairman. Thank you.
Go ahead, please.
All right. So I'm assuming the wickedness that you're talking about is those of us who might be pro-choice, correct?
Just talking about the poor being someone who can't help themselves, being the baby. So just killing the baby.
And you're considering that fetus to be the poor?
Yes, sir.
Okay. And so I just want, it's kind of interesting because you might not have been here and didn't hear that. Did you hear what we did for the poor in the last special session?
No, sir.
Well, poor people got an extension of federal benefits for food stamps. Do you know what food stamps are?
Yes, sir.
Well, we here in Indiana, we cut that off. Not because the federal government cut that off, but because the state of Indiana decided it was time and that giving people money for food was causing inflation. As a matter of fact, there was testimony here for that very same issue. Okay. Are you familiar with that?
No, sir.
So when you say this combination of feeding the poor and taking care of the sick and all those people, what does that have to do with your stance on women's right to choose?
Yes, sir.
How does that affect you?
Someone like feeding the poor, and that's a good thing if someone cannot provide for themselves. That's an excellent thing to do for government, for churches, for people, for neighbors, to help them. But a true poor person is someone who cannot help themselves, cannot defend themselves.
Right.
And according to the Indiana Code, a life begins when human sperm fertilizes a human ovum, and that's life. It's a person. It cannot protect itself.
Well, where does it say in Indiana law that life begins when the sperm?
Yes,
Where'd
sir.
you get that?
My phone died. I had it written down there, so I'm using someone else's for my notes.
Well, that's okay, but do you remember where you got that? You think you got that out of Indiana Code?
Yes, sir. So I asked a representative for that, and he sent the code to me.
Okay, so it's when that sperm fertilizes the egg, right?
Yes, sir.
So if a mother's pregnant and she smokes crack, is she guilty of murder?
It's a good question. You know, crack probably is against the law here, I'm assuming. So,
No, it's not.
It's not? Okay.
No.
I just moved here February, so I'm sorry. You can use everything.
Is it against the law for a mother who has that person in her stomach to smoke?
I guess not, no, sir. So the problem
Well, hold on. I'm not even done yet. Let me see. Is it illegal for that woman who has that person in her belly to go skydiving?
No, sir. May I speak?
So, yeah, you can speak. I'm really confused at your testimony
Yes,
then,
sir.
because it seems to me you should be here fighting for those issues too.
Sure. If someone is smoking because they're pregnant, or
They're
going
pregnant.
skydiving, or riding a horse, that's just normal things you do, but its purpose is not to kill the baby, it's to do whatever pleasure they want to do.
Okay.
But if they ride a horse or smoke to try to kill their baby, that would be murder, yes, sir.
Okay, so you're saying it's the actual process that you're worried about, the actual taking of the fetus and eliminate it
Sure.
anytime?
On purpose, intentional.
Okay. Do you think that could ever be done for purposes other than just getting rid of the baby?
What do you mean?
Okay, give you a perfect example. Woman is on birth control, and she's going through chemo, and she gets pregnant.
Sure. And wants to do, you know,
What do you do?
chemotherapy. So she's doing the chemotherapy to fight cancer, not to kill her baby. If her baby dies in the process of her trying to fight cancer, it wasn't intentional. So that's completely understandable.
No. You didn't hear me. She finds out she's pregnant while she's going through chemo, and she has to make a decision: continue to go through chemo or abort the child.
Sure. So why does she have to abort the child? Why can't she just go through chemo with the child? And if it dies, it dies, but she's trying to save her. She's not trying to kill the
I
child.
see what you're saying. You're saying that there's no decision for her to make. You want to be able to make the law say that she has to go through chemo, even if it kills her child.
She doesn't have to go if she doesn't want to. She wants to try to fight it herself.
She wants to try to fight it herself without going through chemo?
Yes, sir.
But you want the government in that decision-making, but not on the decision-making on whether or not she goes. No.
They don't have to make her do chemo. They don't have to make her not do chemo. But she's not doing chemo to kill her baby. When someone goes to abortion clinic, they're going to kill their baby.
Okay. Thank you for your time, and thank you for being a strong fighter.
Are there further questions for Mr. Aaron? Thank you, sir, for your
Thank you all.
testimony. Yeah.
God bless you.
Next testimony is David Zimba. On deck is Dr. Tyler Johnson, Peter Breen, and then Georgia Barnes. David Zimba now, Dr. Tyler Johnson, Peter Breen, and Georgia Barnes.
Thank you, Senator. Ranking member, senators, I am one of the leaders of an organization called Lawyers for Good Government. It's a nationwide nonprofit. It's dedicated to upholding not only the rule of law, but also advocating for conscientious actions by our governments, both local, state, and federal. And today I come before you to oppose this bill. The majority of opinions in the Supreme Court in Dobbs, it was reasoned that the Constitution can only recognize rights of which were found and known to the founders at the time the Constitution was adopted. Justice Alito and the other justices argued that criminal actions had been taken around the time of the adoption of the Constitution. And our jobs as attorneys is to dive into these details. As one said, a former president, in fact, facts are stubborn things. At the time of our Constitution, the set of laws were founded and created, our court systems adopted what was called common law. And under this framework, even the laws around fetal rights only began when the child could survive outside of the womb. Even a cursory review, one of just Google searching, and of the 18th century shows us that reproductive rights were by and large a private matter, not a public concern. This was also well known to our founders, and how do we know this? Because there's case law. One such involves a woman named Nancy Randolph. She was an unwed 18-year-old who was impregnated by a 22-year-old brother-in-law. In September of that year, Thomas Jefferson's daughter found out that she was pregnant. And not only did she confide and help with that, but she also provided the medication, the herb, to end that pregnancy. Thomas Jefferson found out about it. In fact, he wrote his daughter, and he said to his daughter, "You're on firm ground. Your kindness will help her and count in your favor." So, how does this involve our backstory? And how does this involve the Constitution?
1 minute.
Thank you. Well, two other founders were involved. Patrick Henry, yes, the infamous gentleman who says, "Give me liberty or give me death," represented the gentleman who was charged with the murder of that child. And John Marshall, who later became the Chief Justice of the United States Supreme Court. And they won that case, arguing that it wasn't murder. Now you might say, what does this have to do with the Constitution? Nancy Randolph later married Governor Morris. Mr. Morris wrote the Constitution of the United States. Knowledge of abortions was well known to our founding fathers as well, on top of that, including Benjamin Franklin, who published books including medications and herbicides and procedures.
15 seconds.
Ladies and gentlemen and senators, I leave you with this. Our job in the government is to pass laws that are going to help people, not hurt them. And simply said, that's what this does. On behalf of Nancy and the multitudes of women who came before her and came after her, I plead her case to you to not pass the bill in its current form. Thank you.
Other questions from the committee? Mr. Zima, thank you very much.
Thank you, sir.
Next is Dr. Tyler Johnson. After that, Peter Breen, Georgia Barnes, Jody Smith, and Elizabeth Manring. So Dr. Tyler Johnson, Peter Breen, Georgia Barnes, Jody Smith, and Elizabeth Manring. Go ahead, Dr. Johnson.
Thank you, Senator. Pro Tem Bray and members of this committee, thank you for being here today. My name is Dr. Tyler Johnson. I'm a board-certified emergency physician. I practice in Northeast Indiana. I've got 13 years of experience under my belt. I'm also the adoptive father of 2 children, have 2 children of my own from right here in Indiana. While I support the intent of SB1, it is far from the legislation we need to protect our unborn babies here in Indiana. SB1 is rather vague in its exceptions, seems to expand abortion, can likely be manipulated, and is questionable in its enforceability. I believe both mother and unborn baby, regardless of circumstance, should get safe, prudent, and moral care. Medicine and science clearly dictates and declares that unborn baby is alive with its own unique DNA, developing very distinct characteristics early on in the pregnancy, and feeling pain probably far sooner than we can tell. These are not debated facts in medicine. You must remember that every elective abortion ends in the unnecessary death of an unborn child. While many of these testimonies today likely claim that abortion is a cornerstone of modern medicine, you need to understand that the overwhelming majority of physicians in Indiana do not perform abortions. The overwhelming number of hospitals in Indiana do not perform abortions. So that's telling in itself where abortion stands in Indiana already. When the 13 years I've practiced in the emergency department, I have never had to perform an elective abortion in an emergency situation. I've never had to refer a patient for an abortion. That's pretty telling in a busy urban emergency department. The issue that we are really debating is whether life has inherent value before we are born. That is the issue of question here. It is a human rights issue to its core, and it is our duty to protect the right of life here in Indiana. Professional organizations are looking to shield physicians from criminal penalties for unnecessarily taking the life of another human being. Physicians that provide safe, prudent, and moral care should have nothing to worry about, really at all. I myself personally am very comfortable as an emergency physician with criminal and professional penalties being put in place. As physicians, we are already held to this standard across the board with our other patients. I ask that we remove or refine the exemption language, protect all unborn children, and place appropriate criminal penalties for willfully and unnecessarily taking the life of an unborn child. Have the courage to vote against this bill as it's currently written. Thank you for the time, and I'd be happy to take questions.
Thank you, Dr. Johnson. Are there questions from the committee? Senator Taylor.
Thank you. Did you say that the real?
No, Senator
tone?
Taylor.
Okay, it sounded
Please go ahead.
Dr. Johnson might be saying that too. Dr. Johnson, just for all the people out here You're running for office, right?
Yes, sir.
All right, so you're going to be a member of this body soon, right?
Hopefully, sir.
Okay. And so let's not beat around the bush then, because you might be my colleague one day. Weren't you just here about 4 or 5 months ago talking about people having a right to make their decisions between them and their doctor?
I was here, we had a debate on vaccine mandates as a part of employment, yes.
And what'd you say?
I voted, I would have supported people having the freedom to choose for themselves, as an independent human being, to choose for themselves their treatment and care. This is the most vulnerable population we have, and you're not allowing them to have a choice in their right to life.
Well, let's talk about that, doctor. And I don't want to belittle this issue, and I'm not trying to be, what's the word I want to say, political here. But you know about babies and what it takes for a woman to become pregnant, don't you?
Very much so.
All right, so let me ask you a question there, doctor. So how would a woman know if her child has a fetal anomaly? When's the first point in that pregnancy that she could find that out? Fetal anomaly.
So let's put it this way. Let's say we never had an ultrasound.
No, I asked the questions.
Let's say we never had an
Senator
ultrasound
Taylor,
machine.
let him answer the question.
We never had an ultrasound machine. The day you would find out is the day that child's born, right? So that child, you would never know. And we are wrong. Dr. Mullally stood up here and testified about the errors and with our ultrasound technology and our blood tests when it comes to that.
Doctor, isn't it true that if you want to tell if a fetus has an anomaly, you can't do it until after 12 weeks?
It depends what you're describing. So there are things that occur earlier in pregnancy that we can tell on ultrasound.
So would the fetal anomaly that you saw at 8 weeks could it be different at 16 weeks?
Doesn't change the value of the life of that child.
I didn't ask you if it changes the value. Again, I'll get to that value question first. You are a medical professional, and I'm asking you a professional question.
Yep.
Is the fetal anomaly that you could see at 8 weeks different than what you could see at 16 weeks?
It depends on the case. But you have much clearer fetal anatomy at the farther
16 weeks, right?
Yes.
So the further you go along in the pregnancy, the fetal anomaly would be more prevalent or could be easily detected, right?
True.
Okay. So you're a medical professional, sir, and you're about to join this body that we work in day after day to come up with things to protect Hoosiers in the state of Indiana. And what I want to know is, in your professional opinion, as a medical professional, does our current abortion statute actually cover, is it good so that we don't have fetal anomalies that children could die from?
Are you talking about the law we have on the book, or are you talking about
the law right now?
It does a fairly good job, but I don't think it goes far enough.
And what would you have it go?
I would prefer that child have a chance at life.
At what point? You're a doctor. 16 weeks, 10 weeks, 2 weeks.
So let me phrase it this way. What's the benefit of killing that child?
I'm sorry, I have to ask the questions. I apologize for that, but I don't have to. What time period do you believe?
I have never, as an emergency physician, had to kill a child.
I didn't ask you that, sir.
Never had to. That's my experience, and that's what I'm telling you.
No, I'm saying as a medical professional who's about to join this body, what is the cutoff date for when a child, when an exception should be made or an abortion should be done?
Why does there have to be a cutoff date? Is that value change at 8 weeks, at 6 weeks? Is the value of that life any different?
No,
in my opinion, it doesn't change.
But the
based on
fetal
day.
anomaly that you even admitted to could change. The situation could change from 8 weeks to 16 weeks. Correct, doctor?
But I don't understand your line of question.
The pregnancy, the fetus could change between 8 and 16 weeks.
Sure, a baby could die at 39 weeks.
And you would force that woman to have that baby. even if the baby could not survive out the womb?
The baby has to be delivered one way or another. You don't need to kill the baby first.
The question I'm asking you is, in order for that child to live outside the womb, they have to have a brain, they have to have a heart, they have to have lungs. If they lose those in that process, would you have that mother have that child?
Yes.
Thank you.
Are there any other questions of Dr. Johnson? Senator Yoder, please go ahead.
Thank you, Mr. Chairman. I just need a point of clarification. Did you say that this Senate Bill 1 is providing more access to abortion care than current Indiana code?
I would argue that we're expanding the time frame with which abortion can occur under this new legislation.
So you are saying that SB1, what we are discussing today, is expanding abortion care?
I would be concerned about that under several of the exemptions in the bill now, yes.
So yes, Senate Bill 1 is an expansion of access to abortion care.
That is my concern. That's why I oppose the legislation the way it's written.
Thank you.
Thank you, Dr. Johnson.
Thank you, President.
Okay. Next is Peter Breen. After that, Georgia Barnes, Jody Smith, Elizabeth Manring, and Dr. Roberto DeRoca. I hope I get that name pronounced correctly. Dr. Roberto DeRoca.
Thank you, Mr. President and members of the Senate. My name is Peter Breen. I'm the Vice President and Senior Counsel for the Thomas More Society, which is a national public interest law firm headquartered in Chicago. I'm also a former member of the Illinois House, having served 2 terms, including one as Republican floor leader. For decades, the country has looked to Indiana with admiration because you, the senators of this General Assembly, have advanced the cause of life consistently. And I thank you today for continuing to express that strong desire to advance that cause. Our team at Thomas More Society includes numerous attorneys who are current former state legislators and ledge staff. Our mission is to assist state legislators with the right words to draft pro-life legislation that actually does what you want the legislation to do. I'm here to offer assistance in particular, if you'll take a little friendly piece of constructive criticism from across the border, in particular because the bill includes language in various places that doesn't draw on the rich body of pro-life legislation you all already have in place. And so it creates definitional confusion and doesn't rely on, again, this language that you all have hammered out over months and years of negotiation in many years past of good legislating. As well, I just want to give you one example that's probably the most critical example for me, which appears to be the result of a significant drafting error. It's on page 1 of the bill. It redefines abortion to exclude the direct abortions of certain disabled unborn babies. And that is the irremediable medical condition language. The problem is the definition of that, if you want to do that, it doesn't go there. And by redefining abortion, you then exclude the abortion of those disabled unborn babies throughout all of Indiana law. So what that ends up meaning is you inadvertently create taxpayer-funded abortions of those babies under your Medicaid, Obamacare, and wards of the state programs. You strip conscience protections, because your conscience protections in Chapter 1 of the Abortion Code are tied to the definition of abortion. So a pro-life Christian or Catholic physician who said, hey, I don't want to be a part of aborting, say, a trisomy baby or what have you, they're not going to have the protections they need. And we know from Washington they're getting no help from the federal side. So Indiana law is the only place they've got to look for conscience protections. And actually, so taxpayer funding, conscience protections being gone, as well, you've already got a definition of lethal fetal anomalies, and that term's been used today. It's a medical term, and it has a specific term meaning as well in Indiana statute. But SB1 doesn't draw on that meaning. So I would urge that you please bring that in too, because what you would actually be doing is, at least in this small part, as to those babies and as to your tax dollars, you would be actually expanding abortion in Indiana. And look, I've been there. I wouldn't want a mailer showing up on my doorstep saying, you voted to the greatest expansion of taxpayer-funded abortion in Indiana's history. You've stripped conscience protections, and you've repealed informed consent requirements and waiting periods for abortions on disabled babies.
Thank you, sir. Are there questions from the committee? Okay, Mr. Breen. Senator Taylor, go ahead.
Yes. Did you say you were from Illinois?
I am from Illinois, and I have testified in front of you before, so I might be familiar.
Yeah. You said you were a majority leader?
I was the floor leader, so the guy who actually has to, with all due respect, I have to do all the dirty work.
You were the floor leader for who?
For Jim Durkin, the House Republicans in Illinois.
Oh, okay. I thought you said majority floor leader, and I was like, I never knew.
No, I'm
Okay.
used to dealing from the minority and adjusting bills to make them work. So,
Well, welcome to my world. All right, legislator.
I'm right with you. Thank you.
Mr. Breen, thank you.
Thank you.
Next is Georgia Barnes. After that, Jody Smith, Elizabeth Manring, Dr. Roberto DeRoca, and then Corrine Youngs. Ms. Barnes, go ahead. Thank you for being here.
Mr. Chairman and members of the committee, my name is Georgia Barnes, and I want to thank you for allowing me to share a small part of my testimony. Before I do, I want to make something very clear to all who hear my voice today. I understand that my situation is unique as my fingerprint, and by no means do I believe I'm speaking on behalf of all the women who have had or been sexually abused and/or raped. Reflecting on my personal story, I realized that I could address several topics that seem to be in question in the State House. However, I, at this moment, will address the issue of life being denied due to the previously stated situation. Talking to individuals about this topic, aborting babies, it was mentioned that in the case of rape, the child would be a constant reminder to the mother of a tragic experience, and the child would live a life of being despised. But that can't be much of an argument because there are many situations where people experience tragedy and are tormented by reminders. Do we do away with all reminders? Of course not. At the young age of 15, I found myself with an unplanned pregnancy due to a sexual assault. Even though my home was not ideal, I knew in my heart that it was too precious to destroy a life. Without any coerced intimidation, I chose to carry my baby full term. I also placed my baby for adoption with the files closed. Miraculously, my story has many redemptive testimonies, but I want to say I've met my oldest daughter, and she has been grafted into my life, our lives. And in fact, the second encounter was at her wedding, where her groom had spoken to me through tears, and he thanked me for not choosing the alternative, because if I had, he would not have met his soulmate. I have you know that my oldest daughter has traveled around the world and is very successful, bringing true laughter and joy to all that she encounters. Each of us have a God-designed purpose. Is she walking in hers? I can't answer that. But are you, am I, walking in our divine purpose? It's been 14 years now, and as we continue to grow our relationship, the Lord laid something on my heart to share with her, and I now share it with all of you. I told her, though you were not conceived in the act of love, you were created in love, by love, with love. God is love, and that is an absolute truth. If God, the creator of all things, loves each of us, that he gives us a free will, how can we deny the unborn their free will? Thank you for your time.
Thank you, ma'am, for your testimony. Ma'am, wait, there might be questions. Are there any questions from the committee? No, thank you so much. Next is Jody Smith. After that, Elizabeth Manring, Dr. Roberto DeRoca, Corrine Youngs, and then Dr. Carrie Rouse.
Thank you, Chairman Bray and members of the committee. My name is Jody Smith, and I am testifying for Indiana Right to Life. We stand in opposition to Senate Bill 1. Indiana Right to Life's mission is to protect the right to life, especially of unborn children, through positive education, compassionate advocacy, and promotion of positive alternatives to abortion. Our opposition to this bill is because in its current state, it doesn't stack up to that mission. And the standards that pro-life Hoosiers have come to expect from a legislative branch that has traditionally demonstrated the ability to pass strong pro-life legislation. We find that this bill takes a step backward in protecting the right to life and showing compassionate care to women. It does little to put safeguards in place that guarantee that the 8,414 babies who lost their lives to abortion in Indiana's last year will have the right to life. Safeguards that apply clear and practical guidance for physicians to adhere to. Safeguards that ensure women receive the best care possible that's rooted in compassionate understanding. And safeguards that put protections in place to allow justice for women who might face the unthinkable. And lastly, safeguards that demonstrate compassion towards unborn babies who might be thought to have a fetal anomaly. Indiana Right to Life finds this bill undermines much of the policy legislators fought hard to pass in recent years to protect life, and would hope that these policies would be defended, not walked backwards. It is the organization and pro-life Hoosiers' firm hope that the Senate will hold strong to the commitments the majority of the senators made to Hoosiers over the years, to hold fast and protect the lives of the unborn in the strongest way possible, because this day has come. I think it's worth noting that that includes the majority of the members on this committee today. Unfortunately, we find that this bill falls short of living up to that commitment. That said, we're hopeful that you will work on this bill to make sure that the policies adopted by the end of this special session are nothing short of the strongest pro-life legislation we've known you to be committed to in the past. Thank you, and I'm happy to take any questions.
Thank you, Ms. Smith. Other questions? Senator Yoder?
Thank you, Mr. Chairman, and thank you for your testimony. Am I hearing you correctly that for your organization, 0 exceptions?
We haven't said, we certainly believe in life of the mother exception, but we just feel like what has happened in this particular legislation, probably the best analogy I can say is Swiss cheese. There's so many holes. And indeed, we do believe that that increases access to abortion because of the lack of clarity in definitions and the lack of clarity in statute.
So your organization is only supportive if there's one exception, life of the mother. Where would you draw that line?
I've not said that. So we want to see what legislation looks like and how many of those 8,414 babies would be saved.
I guess I'm curious because we're here to find out what would be acceptable.
Well, certainly it's not acceptable the way that it is. Okay?
That's your opinion. I'm just waiting to hear what is acceptable.
From Right to Life's perspective, it is not acceptable the way that it is.
So what would you suggest?
We would suggest that I could go through each individual aspect. Fetal anomalies not being defined, no opportunity to have, if a doctor makes a mistake, for mothers to bear these babies, that's huge. There's a huge concept there. The other area would be, of course, a woman just signing an affidavit saying she was raped with absolutely no criminal penalties for the person that raped her, or for the woman to have to file a police report or anything in that category. And there's no teeth for the doctor to, what if a woman felt that she was coerced by her doctor or her medical professional to have an abortion? I mean, there's just so many different areas that aren't spelled out and aren't clear. And again, we would see problems in just about every aspect.
There was draft legislation that was circulating. I know it came to me from Mr. Bopp from Terre Haute, who is the attorney for Right to Life.
Correct.
Is that framework more what you're comfortable with? Is that what you are putting forth?
We would be much more comfortable with that framework.
Okay, thank you.
Senator Taylor.
Thank you, Mr. Chairman. You said that you represent Right to Life, the organization Right to Life?
Correct.
Okay, and I don't get your flyers or questionnaires and everything, because I think you know what my answers would be before you send them, so I don't get them. But you said something that really intrigued me. You said a lot of the members of the supermajority committed to supporting right to life?
Well, they're committed to principles of life, and they have asked for our endorsement
And
with specific exceptions.
how many of their members have you guys endorsed?
How many members have we endorsed?
Yeah,
On
I'm
the
interested.
committee?
Yeah. Got 39.
Well, we have endorsed several people on the committee over many years period of time.
Okay. And so those members that you've endorsed have been because they care about women's rights?
I think because they care about the rights of women and children.
The rights of women and children. Okay, this is going to be tough. So where were you at when we were asking for accommodations in the workplace for women who were pregnant?
We were in the conversation.
So how many of those members supported that language?
I don't know how many members exactly did.
I'll get you the roll call. Okay. It didn't pass. Now, I really appreciate the stance that your Right to Life organization takes, because it's a really principled stance, which is you are about women's rights and the right of these children for adoption, for foster care. What a beautiful story from the young lady back there. I think that was a great story on what a person could do if they're strong enough and they can get it right. But I have to tell you, I'm a little intrigued by the fact that that was a piece of legislation, and I'll get to the kids one next. I didn't see Right to Life testify, and I was on the committee. Why was that? I mean, this is for, you remember let me hopefully treat, to allow women to breastfeed in the office, to have a forgive me, women.
Lactating room.
Lactating room, thank you. Where was Right to Life?
There were some complications with that based on some of the requirements of businesses to be required to do things, which was a challenge to us.
So the businesses overrode what women needed for lactate.
Office. Yeah, no, not that part. There's a lot more to the bill than just that part. We certainly stood firm, and we also met with the governor, and we met giving. We'll
bring it up again during this process right here, and I want that same testimony in favor of my amendment when I bring it up on this, because there will be a women for that.
Awesome.
The second piece.
Room.
Thank you.
Okay.
Let's get that done, and I hope you're here to support it. The second piece is children. You like supporting children?
Absolutely, positively.
And you want, so if you had the bill the way you want it, you are definitely sure that more children will be born in Indiana. Yes. That's what you want to have.
Well, we want children to be born that are conceived for certain.
Just more children, right? I agree with you. I love that.
Children are a gift.
All right. What age do we want children to get an education? Do we compel children to get an education in Indiana, ma'am?
Education isn't my area of specialty. I homeschooled my children.
Not mine either, but I know it's 7 years old. And I've had a bill every year to change it to 5 since I've been in the legislature. You, as Right to Life, support children. You should be supporting that bill. So I expect to see your support for that too. The next one. The next one is, were you familiar with the special session we just had?
Of course.
Did you know that we as a General Assembly cut off food stamps for women and children who were poor, who were receiving extra benefits from the federal government?
Nope.
Well, we did, and it'll actually end on July 30th. They cannot receive the enhanced benefits because this body said we will automatically not pay for it. And that is inconsistent with Right to Life too, am I correct? Would that be inconsistent with your position?
I don't know that bill, didn't testify on that bill, haven't looked at that bill, so I don't
What about the policy? The policy of cutting off enhanced benefits for poor people who have children that you support in Right to Life?
We certainly encourage getting women and children the help that they need. Maybe we might go about it a little different way, but we certainly encourage that.
Okay. Last question. You want more children born in Indiana?
Correct.
Are you familiar with the fact that over 50%, a little over 50% of are born on Medicaid in Indiana? Did you know that?
I don't know that
Most
statistic.
babies are born in Medicaid in Indiana. So if they are, then that's going to be paid for through our Medicaid funds that the state pays to, all these Hoosiers pay for, right?
I just don't think you can put a value on a child's life.
I totally agree.
We certainly know one of the things that you're looking at in the special session is increasing benefits. So one of the things that we hope to see, and I've looked at the legislation with that, and there's some really good things there. So we hope to see more.
Increasing benefits of where?
To women and babies.
In Medicaid?
No, I'm not saying in Medicaid. I'm just saying benefits in general.
Well, here's what we're, and hopefully you take this the right way. I think you and I are becoming more like each other, and because we believe in the same things. We might have a different route, but we have proposed as a Democrat caucus for the last 2 biennial budgets to increase Medicaid for children to be born.
Well, I will take a look at it, I promise.
I want you there for that fight, because we're going to fight it again. We want more Medicaid, because we already know that there's going to be more children. So I just want to say to you, thank you for supporting a lot of the Democrat proposals that we're probably going to see, and hopefully you're here this week and you can help support them when we try to move it forward. Thank you.
All right, thank you.
Are there further questions of Ms. Smith? Thank you. No, we're good. Thank you very much. Elizabeth Manring, and then Dr. Roberto DeRoca, Corinne Youngs, and then it'll be Dr. Carrie Rouse, Dr. Spry and Cook, and Dr. Cashman. Go ahead, please.
Chairman and members of the committee, my name is Elizabeth Manring, and I am an ICU nurse. I would like to ask you 2 questions today. The first is, are the preborn human beings? Science is clear on this issue. The University of Chicago in 2018 published a study that shows 95% of biologists agree that life begins at conception. The question that immediately follows is, are we talking about a complete human being? Is this a person, and does it have the same right to life that we do? The father of modern genetics, Dr. Jerome Lejeune, put it this way: if a fertilized egg is by itself not a full human being, it could never become a man, because something would have to be added to it, and we know that does not happen. This is not opinion, this is fact, end quote. In other words, as an embryo, a fetus, a toddler, an adolescent, and an adult, you were always a complete human being. My second question is it ever okay to intentionally kill an innocent human being? At this point, you may be thinking, okay, the unborn are tiny humans, but sometimes you have to act for the greater good. Throughout history, this kind of reasoning has actually been used to strip the rights from inconvenient and marginalized groups in society. 1876 British common law said, "Women are not persons in matters of rights and privileges." The Virginia Supreme Court stated in 1858, "The slave is not a person." We know in our hearts these laws were wrong. It is not our sex or our race that define our value. Neither is it our stage of development, nor the circumstances of our parents. Rather, God has given every human being the same inherent value and right to life, and it is your job as a legislator to protect that right.
1 minute.
Ban abortion, reasonably enforce the ban, and work to prevent pill abortions and telehealth providers from ending the lives of Indiana's children. Follow the example of William Wilberforce and Susan B. Anthony. Do what is hard right now and come down on the right side of history. I ask you to vote against Senate Bill 1 with its loopholes large enough to drive a truck through and actually work to stop abortion in Indiana.
Thank you. Are there any questions? Ms. Manring, thank you very much. Dr. Roberto DeRoca, and then next would be Corinne Youngs, Dr. Carrie Rouse, Dr. Spry and Cook together, and Dr. Cashman. Go ahead, please.
Thank you, Mr. Chairman and members of the committee. My name is Roberto DeRoca. I'm a board-certified obstetrician gynecologist in full-time practice for the last 31 years in Delaware and Madison County. I'm also the immediate past president of the Indiana State Medical Association. I am testifying today on behalf of over 9,000 physicians, residents, and medical student members of the Indiana State Medical Association. We thank you for your willingness to hear testimony on all sides of this difficult issue, in particular from the medical providers you've heard from who will be faced with the responsibility of appropriately implementing any legislation passed regarding abortion during this special session. The Indiana State Medical Association, along with several other healthcare associations, signed a letter to the Indiana General Assembly and the governor strongly advocating for exceptions to any abortion ban, including life and health of the mother, cases of rape and incest, cases of fetal anomalies when the fetus is diagnosed with a condition that in reasonable medical judgment is incompatible with life outside the womb. This committee has already heard eloquent testimony on why each of these exceptions are important for your consideration. Therefore, I will limit my comments to the discussion of criminalization. As you have heard, medicine is not black and white. When called upon to treat complex patients, physicians are trained to gather and analyze data and present it to the patient in an objective format to help them make the best decision for their life, for their health, and for the health of their baby. In many instances, including situations involving each of the exceptions I mentioned, decisions must be made rapidly. Having to wait for legal counsel would freeze this decision-making process. Can you imagine the dilemma the physician faces? The physician's liberty versus the life of the patient and the child. We know that this sentiment is widely shared by the public. A recent public policy polling survey that was released over the weekend stated that 91% of doctors agree that they should be able to help their patients experiencing pregnancy complications and miscarriages without the fear of being charged with a felony. Furthermore, the introduced Senate Bill 1 currently contemplates the ability of a physician to lose his or her license when an abortion restriction is violated. This issue would be referred to the Medical Licensing Board for adjudication. This is the appropriate forum to deal with these scenarios. The threat of loss of a medical license is monumental to a physician. The loss of the license is equivalent to loss of their livelihood, career, and reputation. Although a physician could seek licensure in another state, all adverse actions taken by the state licensing board are reported through the National Practitioners Data Bank and affect the individual's ability to practice in any other environment, not to mention their standing with payers, accrediting bodies, and the entire medical community. Loss of license or even lesser actions against an individual's license is a permanent scar on a physician's record that is not easily overcome. In conclusion, I ask that this committee to include exceptions for health, life of the mother, rape, incest, and fetal anomalies, or fatal fetal anomalies. I also ask the committee to maintain the current bill's framework of adjudicating violations before the Medical Licensing Board. Thank you.
Thank you, Dr. DeRoca. Are there questions from the committee? Thank you for your time. Thanks for being here. Next is Corinne Youngs, then would be Dr. Carrie Rouse, Dr. Spry and Cook together, Dr. Cassandra Cashman, and then Angela Young. Go ahead, please.
Thank you, Chairman and Committee. My name is Corinne Youngs. I serve as Policy Director and Legislative Counsel to Attorney General Todd Rokita. The Attorney General commends you for the pro-life legislation that you've passed over the years and that we have defended. The Attorney General opposes this bill as written because it falls short of vigorously protecting life. There are a number of substantive and technical issues with this bill, but because I'm limited on time, I intend to focus on the vague and broad exceptions to the prohibition on abortion. First, it is not considered an abortion to terminate a pregnancy where the fetus suffers from an irremediable medical condition that is incompatible with sustained life outside the womb. What does this mean? It's extremely vague. How long is sustained? Is that 1 hour, 1 week, 1 month, 1 year? It's unclear. And wouldn't any pre-viable unborn child meet the definition of incompatible with sustained life after birth? Doesn't this exactly conflict with our law banning abortions based on discrimination on disability? So if you combine Down syndrome being irremediable, not able to be repaired, and pre-viability not sustainable with life, that equals an abortion in Indiana under this bill. Second, an abortion may be performed if it is necessary to prevent substantial permanent impairment of the life of the pregnant woman. Again, what is considered a permanent impairment? There are countless impairments a woman could face during her pregnancy: medical, mental, social, physical, familial, employment. The law provides no limiting principle, so anything could be considered an impairment. Third, if the pregnancy was a result of rape or incest, the woman need merely sign an affidavit asserting, "I was raped," and get an abortion. There was no requirement that she provide any evidence or report to law enforcement. Without such measures, there's no justice for the woman, and only the perpetrator and the abortion industry will benefit. There's no accountability for the criminal in this exception. And most egregious of all, there is no gestational limit for any of these exceptions. I am almost 33 weeks pregnant, but even a woman at 40 weeks could get an abortion under any of these exceptions. The exceptions here nullify the rule and do not prohibit the practice of abortions. The Attorney General will defend the legislation regardless of what you pass, as is his job. But if it is your intent to pass legislation that prohibits abortion throughout pregnancy with limited exceptions, this bill will not do that without substantial changes. But please consider what's right for Hoosier babies and mothers. They deserve better. Thank you.
Thank you, Ms. Youngs. Are there questions from the committee? Senator Melton.
Thank you, Mr. Chair. Thank you for your testimony. Correct me if I'm wrong, in 2017, we passed a law that allows the Medical Licensing Board to revoke the license of a physician who the Attorney General proved can violate an abortion law. Is that correct?
Say that again. I can't hear you.
In 2017, the Indiana General Assembly passed a law that allows the Medical Licensing Board to revoke the license of a physician who the Attorney General can prove had violated an abortion law. Is that current law right now?
Is that for the selective abortion ban? Is that what you're referring to?
I believe so.
I think that has a separate, yeah, I believe that's
It's Indiana Code 25-22-588.
I believe that's correct. I think I was just looking at that earlier. There's a special section on the selective abortion ban that allows.
I guess the reason why I'm asking is this compiling or making it even more broader or more stricter for doctors in terms of dealing with abortion laws?
I think generally this bill is making it broader because it's vague, and so it's difficult to interpret. So I think we need clear, precise language as to what we're accepting and what we're not under this law. That answers your question.
Not really, but it kind of has a little clarity in terms of you guys' position on this. To me, it seems like we're making it even more stricter, and we're adding more red tape for doctors when it comes down to the health care of the mother. So that's what I'm seeing as we're discussing this issue a little bit further.
Well, I think that the doctors need to know what the exceptions are. They need to know what the law means to be able to decide either way.
Don't we currently have that in code now? It's not clear now?
I think that there's definitions in code now that are clear that could be added to this bill.
What we're talking about now is not law yet.
Yeah, I know it's not.
Okay, thank you.
Additional questions? Senator Lannon.
Thank you, Mr. Chair. So the Attorney General's position on the rape exception is he's not satisfied with just merely an affidavit?
Right.
And he would what, only allow for the exception if the victim of the rape prosecutes the case?
I think there needs to be some accountability for, the criminal in this instance, because there's abuse going on.
Are you aware of the traumatization that can happen to a person if they're raped, and the re-traumatization that can occur through the prosecution of a person?
The woman deserves justice for the situation.
There's nothing in this bill that says that if the woman wants to prosecute, she can do that, right?
Yeah, she can.
So there
There's
again,
no requirement to do so, and there's no requirement that the physician report here.
right? So the Attorney General's belief is that this bill should be changed to allow for an abortion only where the victim of the rape pursues criminal charges.
I said report to law enforcement, show evidence of a rape, some sort of accountability for this exception.
Well, if you report something to law enforcement, don't you think that you ought to expect that there will be a prosecution?
Yeah, I would think so, some sort of investigation at least.
Okay. Thank you.
Senator Yoder?
Yeah, thank you, Mr. Chairman. I was curious if you knew what the backlog is for rape kits in Indiana.
I don't.
And how, for the AG, if the AG isn't going to believe the victim and they have to, in order to just go by the affidavit, which is what this language is requiring, the AG is saying we need a police report to be filed. What timeline are we talking here? I mean, can the woman seek care, abortion care at that time? Or is she going to be required to wait a certain length of time? I mean, I would like to hear what the current rate is of the backlog for rape kits in Indiana to be able to make such a statement. And I'm just curious what the AG thinks about how long is long enough for this individual to receive the abortion care that she is requesting.
I don't know what the backlog on rape kits are, and I don't know what the timeline should be. We're not the legislator, but I'm just advocating that there be some clarity in the language and some sort of precise language to tighten this up. Because right now it's very broad.
How is it broad? I mean, an affidavit, it says under perjury, I mean, she is having to sign this affidavit.
There's an affidavit
that's
and
confidential.
It says, well, it's confidential, which doesn't explicitly say it's who it's confidential from, but also the woman could have been raped, and then there's no time frame from when she has to go. I mean, she could be raped, carry the baby all the way to 38 weeks, I don't know, and then get an abortion. I mean, it's very broad in that way. So I'm saying,
What does the AG want?
The AG is not a legislator. I'm just advising on, we've often have defended abortion legislation on vagueness, and so that's a concern, is having precise language.
So weeks, the AG isn't clear on the weeks, and this legislation isn't clear on the weeks, but he's not willing, the AG isn't willing to say, this is my line in the sand, I want this many weeks.
No, it doesn't have a line in the sand.
Okay, thank you.
Senator Taylor?
Thank you, Mr. Chairman. Hi, Corinne. Congratulations.
Oh, thank you.
Yes. I'm sort of curious to your evaluation of this piece of legislation, Senate Bill 1 in its current form. Did I just hear you say it could be up to 38 weeks and they could claim?
Yeah, there's no limit on the week for the rape. So it just says that there's an exception for rape or incest.
Yeah.
There's no gestational limit to that.
Yeah, kind of interesting because I read it the same way. But I'm also concerned about the incest part too. Okay. You get, correct me if I'm wrong, but in a lot of cases, the state, in like Chin's cases where there's an incest, doesn't the Attorney General have to represent they don't prosecute?
No, we don't.
So that goes to the county, and it says the state of Indiana, right?
I think we don't do Chin's cases. DCS has their own.
Yeah, but I'm saying if there's a case of incest or something like that, who handles it?
Like in what situation?
Well,
What do you mean?
I'm glad you asked that question. You brought up doctor notification, for example, the case of rape. Don't they also, under current law, have to, they have to notify in abortion cases, right?
If there is a woman that comes in and under 16, there has to be a report. And then also, I think there's a mandatory reporting requirement for minors.
For what?
For minors.
Right. What about adults?
There's a mandatory reporting for the coercion bill we passed last year.
And it's now law, isn't it?
Yes.
So there is mandatory reporting. I'm glad we got to that. So now doctors, not only because just so everybody knows, there was a reversal of the coercive abortion, which is now law in the state of Indiana, right?
The coercion bill, yeah.
Yeah.
The coercion law.
And the person who actually hears about that coercion has to now mandatorily report.
Right.
Right. That doesn't matter if it's the receptionist, if it's the doctor, if it's the security guard standing outside. They have to report, don't they?
Right.
Okay.
Includes the
So now we have mandatory reporting in Indiana for an abortion, and you're sitting here telling me that now you want doctors, correct me if I'm wrong, to report that there's been a rape or incest. Like you want that as part of this bill.
Yeah, I don't know if it needs to be the doctors or the women need to go report them. I mean, there's a bunch of different options for that, but there should be some sort of accountability for the crime that's been committed, the abuse.
Oh, I 110% agree with you. It's kind of like I'm in the twilight zone right now, Corinne, because it sounds like the same thing I brought up in my press conference. You're right. There is no reporting. The person who actually committed the incest or the rape could just walk scot-free, and the woman just has to fill out an affidavit, which is confidential. Confidential to who? The prosecutor? I don't know. So that's what you're concerned about. Now here's the last question I have for you. Are you concerned about it, or are you concerned about enforcing it? How would you enforce it in its current form right now?
Enforce what exactly?
The law, which is your job as the Attorney General's office.
Well, our job is to defend the law. We don't have any enforcement mechanism in this bill.
Okay, I'm sorry.
So there's a little nuance there.
I do. There's a nuance. You're a recent law school graduate. I'm an old school graduate. So we used to use the term enforce, but now you use the term. What's the term you use now?
Well, we defend the law when this is challenged.
We used to say enforce the law.
And then enforcing the actual law itself, if there's criminal penalties.
Okay, so how would you defend this?
It would be the prosecutors.
Well, how would you defend this law, ma'am, that we have right here? That Senate Bill 1. Your job is to defend the law that we set out.
Right, it depends how it's challenged in court. So if there's a vagueness challenge, then we would.
Do you consider this legislation vague?
I do.
Thank you. That's all I wanted you to hear. Thank you.
Dr. Caroline Rouse.
Hello, my name is Dr. Caroline Rouse. I'm an OBGYN specializing in maternal fetal medicine. I am here to testify on behalf of myself, my patients, the Indiana section of the American College of Obstetrics and Gynecology, and Indiana University Health. I am an expert in caring for the sickest women in the state of Indiana, and I am qualified to testify on this subject matter. My testimony today focuses on the necessity of including an exception for the health of the pregnant individual if an abortion ban is enacted, which is not currently included in the proposed legislation. The current bill allows for abortion if it is, quote, necessary to prevent a substantial permanent impairment of the life of the mother, end quote. As a healthcare provider, I cannot interpret the legal nuances of this. There is no single moment in healthcare where I can say that a risk will be permanent or not until it is likely to be too late to reverse that risk. My colleagues and I then wonder, how life-threatening does the condition have to be? There are no medical definitions for substantial permanent impairment, and given the professional and personal repercussions of possibly misinterpreting laws, including criminalization, the lack of clarity in this proposed legislation makes it worse. There is no defined moment when a serious medical condition becomes a life-threatening medical condition. My job as a maternal fetal medicine physician is simple: to keep my patients safe. While the overwhelming majority of the time this results in a healthy mom and baby, there are times when I must use my extensive training to predict and prevent sickness, disability, and death. This includes counseling my patients on options, including abortion, and then allowing them to choose for themselves. Abortion is an essential component of comprehensive, evidence-based health care, and we strongly oppose any effort that interferes in the relationship between a person and their health care professional and access to that care. The proposed abortion restrictions in Senate Bill 1 would eliminate over 98% of abortions. The complications resulting from those pregnancies will result in significant morbidity and increased maternal and fetal mortality for the people in the state of Indiana. If hearing those predictions is not sufficient, I urge you then to look to broader public opinion. 71% of Hoosiers say it is important to them that people in Indiana have access to all reproductive health care options, including abortion. And 74% say that the decision to have an abortion or not should be left between the pregnant person and their doctor. While I and the organizations I represent emphasize that abortion is an essential component of comprehensive, evidence-based care and strongly urge you to vote against Senate Bill 1, we recognize that legislation severely limiting abortion is likely in the state of Indiana. As you debate Senate Bill 1, my colleagues and I strongly urge you then to rely on your highly trained physicians and amend the bill to include clear language as it relates to health of the pregnant mother.
Dr. Rouse, thank you. Are there questions for Dr. Rouse? Senator Yoder.
Thank you, Mr. Chairman and Dr. Rouse, for being here. I have a question about this regarding or uncertainty regarding how many weeks. We heard from the AG that there is no limit in this language, but it is my understanding that there are no late-term abortions in Indiana, so I would imagine that that would be still the case. And I have heard that it's the current 20 weeks currently in law, that's Senate Bill 1 would be following. However, I have also heard rumor that the 20 weeks will be changed to 12, and I have heard 8. So I would like to know, from your position and your practice, what would that mean for the care that you can provide and for your patients, changing from 20 weeks to 12 and then 8?
So an earlier ban to sometime in the first trimester, 8 or 12 weeks, would severely compromise our ability to take care of these patients. The physiology of pregnancy is such that some of these changes that can lead to compromise in cardiac or renal function are not going to become evident until a little bit later in the pregnancy, in that second trimester. Fetal anomalies are not reliably diagnosed in the first trimester, with few exceptions. In cases of rape and incest, there may be delays in reporting because the patient is afraid to come forward with their rape. So if it is an earlier ban, many patients will suffer.
So fewer weeks, more patients will suffer.
Yes.
Thank you.
Dr. Rouse, thank you for your testimony. And before we go into more, are there any other questions for Dr. Rouse? Oh, I'm sorry, Senator Lannon. I apologize.
Thank you. Just one question. I missed a part of your testimony. You had testified something about you think that the current bill will eliminate 98% of all current abortions, and then you said something after that. Could you maybe refer to your testimony and repeat that, please?
Sure. Happy to. The proposed abortion restrictions in Senate Bill 1 will eliminate over 98% of abortions in the state of Indiana. The complications resulting from those pregnancies which continue because of the ban will result in significant morbidity and increased maternal and fetal mortality.
Thank you. Thank you very much.
Senator Taylor, did you have a question?
Thank you, Mr. Chairman. Dr. Rouse, who would be affected the most if this abortion ban was to be put in place?
This is going to disproportionately affect patients who already are struggling to access health care, so people of lower socioeconomic status, people of historically marginalized groups such as Black and Indigenous women.
Yeah, and that's, you know, that kind of leads to my second question. I always thought that this was about that kind of protection. It was like the people who are the most vulnerable, we don't want to hurt anymore. You know, like that was our Christian values. We adore people who we can help the most. So you're saying that, you know, if we were to pass this bill as it is on its face, people who are poor and people of color would be affected the most. Isn't that really where our infant mortality and maternal mortality disparities exist today?
Yes, you heard earlier from Dr. Abernathy about the disproportionate effect of legislation like this on these communities that are already suffering more as a result of these bans that would be put in place.
So we would add to the actual punishment or the disproportionality of minorities and poor people.
Absolutely.
Thank you.
Thank you. Thank you, Doctor. All right, a couple announcements. As I indicated at the start of today, and as we had posted, we're going to try and end up testimony pretty close to 5 o'clock. We'll go a little bit after because we've got at least a few people on this list that we want to hear from today. I'll say that we have literally hundreds of people listed to testify, and as you know, even at 3 minutes, when we've tried to limit people at 3 minutes, we will not be able to get to everybody. We'll have testimony tomorrow as well. If you are on the list today, you will be on the list tomorrow, but you'll need to come back in tomorrow to check in, and we'll try and continue to work through the list with as much dispatch as we can, making sure, though, that we have opportunities to hear what the folks have to say and that the members of the committee have the opportunity to answer questions. Having said that, I think we have Drs. Spry and Cook to testify together. After that, it'll be Dr. Cassandra Cashman and then Angela Young. Doctors?
I'm Dr. Brian Cook, an obstetrician and gynecologist from Bloomington, Indiana, and I'm here representing the Indiana section of the American College of Obstetricians and Gynecologists. I have with me.
Hi, ladies and gentlemen. My name is Danielle Spry. Not a doctor, although I do appreciate the honorary degree. My name
Just gave you a promotion, right?
It's okay, yes. I got quite the promotion today. I am testifying on behalf of myself and the patients I care for. I am a Hoosier, I am a wife, I am a mother, and I'm a labor and delivery registered nurse. But today is my personal story. In 2019, my husband and I were living the dream. We had a 1-year-old son at home and just found out that we were pregnant with our second child, our daughter, Charlotte. We couldn't have been more excited. In preparation for her arrival, we sold our house and moved in with my parents while we were building our new home to accommodate our growing family. Everything seemed to be going great until it wasn't. At our 18-week post-fertilization anatomy scan, the one where you go in to find out if it's a boy or a girl, my general OB saw an anomaly on the ultrasound. Now, they didn't go into great detail about what this anomaly meant. They did tell me not to Google it. We were urgently scheduled for maternal fetal medicine at 19 weeks to find out the extent of her abnormalities, and there in that office, our world was turned upside down. Charlotte, my beloved daughter, had a large hole in her diaphragm, allowing most of her abdominal organs up into her chest, crowding the space and not allowing for lung development. Her heart was sandwiched against the side of her wall, or the side of her chest wall, and it was deformed. The doctors painted a very grim picture of what the delivery and the first few moments of her life would look like. We would watch her suffocate to death. My husband and I knew that as much as we loved her and as much as we wanted to bring her home, allowing her to suffer was not an option. We ended our pregnancy at 19 weeks and 6 days, which was the last day in Indiana we could legally have the procedure. I delivered my daughter, and I was able to hold my baby girl peacefully and say our goodbyes. My husband and I made that decision to be merciful and spare her a very short life of suffering and pain. I cannot even fathom the trauma if I didn't have that choice of being forced to carry her to term, fielding questions from strangers about my growing belly, watching my body change and feeling her kick, only to have her die in my arms, scared, gasping for a breath that she was never going to take. My husband and I mourn for our daughter every day and wish that we didn't have to make that awful choice, but given the two options of delivering to watch her die or choose mercy and end the pregnancy early, we believe that we gave her the greatest gift of love. Thank you.
Open to any questions.
Thank you very much. Are there questions from the committee? Senator Yoder.
Thank you, Mr. Chairman, and thank you, Ms. Spry, for your testimony. And we've heard from people today that these matters are black and white. And that's not something that I believe. I think these matters are so much more difficult and complicated. Can you share how your life, what would it have been like if your government had forced you to carry that pregnancy full term?
I think not having the option was the scariest part of that initial diagnosis. It was very, very scary. Had I not had the option to deliver her early and show her mercy, it would have been so traumatic to carry her every day and feeling her move and feeling her kick and watching, just as people do, because you're pregnant and people are excited and they ask you questions about your belly and is it a boy or a girl and, you know, what's the theme of the nursery? Everyone wants to be excited for you, but knowing that ultimately I would not have been delivering a live child or a child that would have had any life outside of me would have been just terrible. Not to mention the physical trauma that your body goes through during pregnancy. It would have been really, really awful.
So what I can appreciate is, and I marvel at your grace and bravery.
Thank you.
You had the opportunity to have these difficult conversations with you, your husband, your physician, and whoever it is that are in your inner circle to talk about this. And what would you say to someone else who might choose differently?
I would say I respect that. If you choose, that is the ultimate, to become a mother, to not become a mother, that is the ultimate personal choice that you could possibly make. And if somebody in my similar situation with a daughter who would have been born only to die shortly thereafter wanted to carry to full term, I say that's great for you. That's great for you, and I absolutely respect that and would support any of my patients who decided that that's what they wanted to do. That was not what we wanted to do. As a nurse, I have seen suffering, and I have seen pain, and I have seen what these situations can look like, and so using my clinical judgment and also my heart and my values, that was how we made that choice.
Thank you so much.
You're very welcome.
Thank you very much. Oh, Senator Melton, go ahead.
Thank you, Mr. Chair. Again, I want to echo Senator Yoder's comments. Thank you for your bravery, for sharing your testimony today. Thank you both. And I'm not a doctor, I'm not a healthcare professional, and I'm not a woman. And so the questions I asked from a medical perspective, and just to further understand, why was it the fetal anomaly identified so later in the pregnancy?
Absolutely. Oh, yeah.
With many of these anomalies, they can't be detected reliably earlier in the pregnancy. Development is an ongoing process over the course of the pregnancy. Earlier in pregnancy, many structures either have not formed yet or have not formed of a size that they can be seen easily with the pregnancy. And that's part of why the standard for ultrasound for diagnosis of these abnormalities has been typically at 18 to 20 weeks post-fertilization, which is often the earliest that these conditions can be developed or can be diagnosed. In situations like Danielle's, she had ready access to care living in an urban area, and so things moved relatively quickly. Coming from southern Indiana, that's often not the case as well. It's not unusual for my patients to have to wait a week or two from the time that we see them to the time that they can get to a specialist in Indianapolis, particularly due to having to take time off work, having to find transportation, and this is not something that is usually solved at a single visit as well. This is often an ongoing process over several visits, making these very, very difficult decisions.
And that's why when we talked earlier, access to quality health care is so extremely important, especially for the urban and rural communities. So
exactly.
Thank you for sharing your testimony.
Senator Taylor.
Thank you. Doctor, I'd like to elaborate just a little bit for you. I thought I heard you say that a lot of these abnormalities cannot be detected because the actual organ has not been developed. Is that what I heard you say?
Not developed to the point where it can be readily assessed or readily viewed.
Yeah, you have to forgive me, doctor. I explained this earlier. I'm a doctor, but I'm not in medicine. So when I say this, so let's talk about, let's take the fetus fertilizing the egg. How long before a physical cranium forms? Or I don't know. Take me through if you were doing 101.
Those structures start to develop fairly quickly. Okay. However, developing to the point where they can actually be seen is a much longer process.
Okay, so
for the instance of a cranium not developing, if we're talking about the skull, that might not be until 10 to 12 weeks post-fertilization that we can see that.
How about a heart?
If we're talking about the brain, that might be seen a little bit earlier. Heart, generally, if there's no development of the heart, there's never going to be development of a heartbeat or the structure that will eventually become the heart. And so that can often be diagnosed much earlier in the pregnancy. On the other hand, with the kidneys, a condition called renal agenesis that Dr. Abernathy referred to before, the kidneys do not do their primary function until further along in pregnancy, and as they're small, they usually can't be seen until about 18 to 20 weeks post-fertilization, when you can actually start to see some urine filtering through them. And that is a condition that's associated with 100% mortality, but can't be diagnosed any earlier than that.
Right, so 16 to 18 weeks. Probably when you do
18 to 20 weeks.
18 to, see, you did it to me again. 16 weeks post-fertilization?
18 to 20 weeks post-fertilization.
18 to 20 weeks.
We're used to working from the last menstrual period, which is 2 weeks before, so I'm doing all the math backwards in my head. I'm usually talking 20 to 22 weeks.
All right.
Post-fertilization, 18 to 20 weeks.
Post-fertilization, 18 to 20 weeks. So let's say we decide in this body to do, I don't know, 8 weeks as an exception. You're telling me that if a woman comes to you and has this anomaly, like the young lady discussed here, then our law would force them to carry that baby to term and watch it suffocate.
Yes.
I think I ought to ask that again. If we were to put a limitation on the rights of women that said you had to do it before 12 weeks, then we could, in this young lady's situation, she would carry her baby to term and watch it suffocate.
She would have had to carry her baby to term knowing that there was a 100% chance for it to die after delivery and accepting all of the risks that are associated with that pregnancy as well.
If it was 16 weeks, would it be the same result?
Yes.
If it was 20 weeks, would it be the same result?
Quite possibly, especially depending on access to resources and care.
If it was 22 weeks, would it be the same result?
There's really no upper limit that we can say these conditions cannot be found.
Thank you.
Thank you both very much. Appreciate you being here. Next is Dr. Cassandra Cashman. After that will be Angela Young. I think it is just about 5 o'clock now. I'd like to try and get a couple more witnesses in after that. So Dr. Cashman, Angela Young, David Hewitt, and Jennifer Crossley will be the next two after that. Dr. Cashman, please. Thank you for being here.
Dear Chairperson and committee members, my name is Dr. Cassandra Cashman. No? My name is Dr. Cassandra Cashman. I'm a family physician who's also completed fellowship training in women's health and have devoted my career to serving Hoosiers since moving here in 2013. Since 2017, I have served as the medical director of the Center of Hope based in an Indianapolis area hospital network, providing medical care to survivors of domestic violence, human trafficking, and sexual assault. Although this wasn't part of my original testimony, I was able to do a bit of research while I was waiting, and I wanted to let you know that the Indianapolis Star reported 4 months ago that there are 6,600 plus sexual assault kits that have been collected and not prosecuted, and that is only for Marion County and not Indiana. They anticipate that the backlog to work through just for Marion County would be several years. I'm here speaking solely as an individual physician, and my statements and opinions do not reflect that of my employer. Sexual assault is more common than you would like to imagine. Sexual assault survivors come from all walks of life, all ages, and all backgrounds. Sexual assault does not discriminate. While I agree that rape and incest should be an exception to any abortion ban that is put into effect, the affidavit requirement does not have the best interests of patients at heart. Many survivors of sexual assault would be unable to sign such a document. For example, patients with severe mental illness, cognitive impairment, or dementia? What about patients who were incapacitated due to drugs or alcohol that were administered to them by their rapists? Patients who experienced severe physical assault at the hands of their assailants, or patients who were unconscious? Importantly, the bill as written does not make clear whether a minor who is raped can sign their own affidavit to access medical care to end a pregnancy resulting from rape. Please consider the case of a patient I cared for at the Center of Hope. To protect her privacy in this particularly gruesome case, I have left some details vague. A young minor under the age of 14 came in after she learned that she was pregnant. She had been sexually assaulted by a first-degree family member and was carrying a pregnancy that was both the result of rape and incest. She was able to access a pregnancy termination, and forensic analysis indeed demonstrated that her first-degree family member fathered the pregnancy. In my conversations with the patient's mother, it was revealed that she was aware of the multiple instances of sexual assault, but had not intervened, telling me that she herself had experienced similar assaults as a young girl at the hands of her own first-degree family member and did not feel that intervention would be helpful or warranted. Who would sign this patient's affidavit? This bill will not help women and girls who are survivors of sexual assault. Currently, they are able to receive the care they need, and the requirements stipulated by this bill will only further traumatize them and create barriers to accessing medical care. I strongly urge you to remove any affidavit requirement for abortion services in the event of rape or incest. Thank you.
Dr. Cashman, thank you. Is there questions from the committee? Yes, Senator Yoder.
Thank you, Mr. Chairman, and thank you, Ms. Cashman. So we heard today from pastors to the AG's office that there is a flaw in this language that is the result of there being no criminal reporting requirement in the case of rape. And I just want to know, how does this impact patients? If this is so critical, and we know in Marion County, I wanted to know throughout the state, what is the backlog of rape kits? But how would this requirement impact patients?
Do you mean the affidavit requirement, or if there were a legal reporting requirement?
If there were a legal, both actually, but if there, you can start with one and finish with the other.
For the affidavit requirement, as I mentioned, there are going to be many people who are simply unable to sign that. You can't, they don't want to put themselves at risk of perjury, because if they were, incapacitated for some reason, or someone who is a minor, or someone who has cognitive impairment, they are not able to sign that affidavit without actually perjuring themselves, because there may be instances in which, although a rape is strongly believed to have occurred, and ultimately it's up to the legal system to decide whether or not that is what happened. But when the patient is reporting that she was raped, I, as her physician, believe her and advocate on behalf of her health. Many patients do not report that they are raped to, first of all, anyone, but especially law enforcement, for a variety of reasons. We know that there are approximately just under 500,000 cases of sexual assault in the United States that are reported per year in women over age, or women and girls over age 12. Additionally, it's quite shocking for many people to learn that the statistic called the rape-related pregnancy rate, this is actually something that the CDC calculates, is 5%. What that means is that in a woman of reproductive age, which they consider to be 12 and up, if you are raped, you have a 1 in 20 chance of becoming pregnant at the hands of your rapist. There are many people who are unable to report to law enforcement, either because they aren't aware that that is actually a requirement, they are scared of retribution, they are in a human trafficking situation or an extremely dangerous domestic violence situation. There may be other repercussions that we simply can't imagine. Women know their own lives better than any of us possibly could, and they are the ones to determine whether or not they feel like it is important, safe, and possible for them to report to law enforcement. When a law enforcement report is made, as you've just heard, clearly there's not a high priority for processing these kits, and there is really very limited chance that any type of resolution of the legal aspect of the case would come about in time for the woman to be able to receive sexual assault care in terms of a pregnancy termination that was fathered by the pregnancy of the rape.
Thank you.
Thank you.
Doctor, thank you very much. Next, Angela Young. After that, David Hewitt, and then Jennifer Crossley. Thank you for being here, Ms. Young. Go ahead.
Hello, my name is Angela Young. Thank you for this opportunity. My story is much different than that of the woman who had to give up her child, Charlotte. But it is still giving up of a child. I just want to thank you again for this opportunity, and I want to share Psalm 139:13. For you formed my innermost parts, you knit me together in my mother's womb. In 1987, I had 2 small boys and found myself pregnant yet again. I had an abortion, which I greatly regretted. I have 4 boys, and she would have been my only girl had I given her a voice. Abortion is ugly. It greatly affected me for years. Not only was my baby girl gone, but it affected my boys as well, for they had lost a sister that they could have had. So I'm here today to challenge you, all of you that ran on being pro-life. Please, please don't vote this bill in. Let's protect the unborn. Please, let's be a state that's a battering ram that brings the change. Let's not be a state that has more bloodshed of our own Hoosiers as well as those from other states. I plead with you to let the bloodshed stop here. Please hear the plea. Let all babies, no matter how small, be heard. Thank you.
Thank you, Ms. Young. Are there any committee questions?
I just had one question.
Ms. Young, would you be willing to answer a couple questions for us?
Ms. Young, thank you. First of all, thank you for being straightforward with our committee about your situation. But you heard the testimony. Did you hear the testimony of the young lady before you about her pregnancy that she had to terminate?
Yes, I referred to that.
Would you want the government to require her to carry that child and have it suffer, or be able to make the decision between her and her doctor?
I opened with saying that my story's not like hers. This is a very, very hard thing.
Yeah.
I don't have all the answers. I don't know what they all are. I don't know what's an exception. I don't know what is. I just know that, my God, we don't kill babies.
Right.
We don't know what could have happened. There are a lot of ifs. We don't know. We don't have the answers. So I can't really answer that one way or the other. Maybe something miraculous would have happened. Maybe that baby would have taken care of itself and she wouldn't have had it. We don't know. We don't know. I just know from my own experience, and that's all I can share from.
Yeah, and I appreciate that. Thank you. Thank you for your time.
Thank you, ma'am. David Hewitt. Mr. Hewitt.
Thank you, Mr. Chairman. My name is David Hewitt. I am one of 3 pastors of Cruciform Bible Church in Indianapolis. I have lived in southern dunes in southwest Indianapolis for over 18 years. Perhaps you've heard of me. I am opposed to Senate Bill 1 as it is currently written, and I would like to read a passage of Scripture and then comment on it briefly, as well as comment on the text of Senate Bill 1, or at least the issues contained therein. I'll be reading from Exodus chapter 21, verses 22 to 25. Yes, Exodus from the Torah, which I think should be particularly relevant for one of the previous speakers. It says, when men strive together and hit a pregnant woman so that her children come out, but there is no harm, the one who hit her shall surely be fined, as the woman's husband shall impose on him, and he shall pay as the judges determine. But if there is harm, then you shall pay life for life, eye for eye, tooth for tooth, hand for hand, foot for foot, burn for burn, wound for wound, stripe for stripe. Indiana Code already declares explicitly and correctly that life begins at conception. Therefore, such human beings ought to be protected under the law equally as human beings. The text I just read makes clear that such a thing is just. Note, it says if there is harm, either to the mother or the unborn child who was born prematurely because of the aforementioned altercation, then the assailant was to be punished to the extent that he harmed either. Senate Bill 1 wrongly states that abortion should be allowed in rape or incest. The rapist ought to be punished, but the child ought not to be put to death for the crime of his father. Further, that child is still the child of his or her mother. SB1 needs to be amended to remove this exception. Further, in light of this scripture with regard to SB1, specific criminal penalties are therefore needed, and they need state enforcement. The Indianapolis city prosecutor has already gone on record saying he would not enforce any law banning abortion, and most abortions in Indiana are done in this city. Therefore, SB1 needs amendment here. The bill wrongly defines life beginning at implantation. This is egregiously wrong, and it is a terrible step backwards. Life begins at conception, as that is when we have a new human being. Anything that would cause the child, therefore, to be prevented from implanting into his mother's womb, including the morning after pill, which this bill allows to remain legal, must be outlawed. SB1 needs amendment here. Another bill that was authored in this last legislative session by Representatives Payne, Nisley, and Jacob addressed all of this perfectly. It was truly a righteous piece of legislation. SB1 ought to be amended to reflect HB 1282 generally. I am praying for you to do what is right. And I remind you, as others have, that civil authorities are put in place by the one true God per Romans 13. You are under obligation to rule in accord with what he has said is right. End all legal abortion in our states, ladies and gentlemen. Roe is gone. Governor Holcomb has said that he would sign any bill against abortion, no matter how restrictive. God has moved these obstacles and more out of your way. There's a supermajority of supposedly pro-life Republican legislators here. You have no excuse not to end abortion now in Indiana. Do not delay, do not make excuses. I and many others will be behind you if you do what is right. But if you refuse to, we will oppose you and will pray that God will humble you. He's done that to civil leaders before. So trust God, do what is right by him, and thank you for the opportunity to speak here this afternoon.
Thank you very much. Other questions? Senator Taylor?
Thank you. Thank you, Mr. Chairman. Did you say that Ryan Mayer said he wasn't going to prosecute any law in regards to abortion?
The Indianapolis city prosecutor has said that he would not prosecute laws that would outlaw abortion.
Let me make sure I understand. What do you mean? Give me an example.
The point is that we would need state enforcement so that when abortions do take place, that they are prosecuted properly.
Prosecuted for what? Who?
Prosecuted for the crime.
Who? What? Who?
Everybody who's partaking in the abortion, certainly the abortionist, but also in the case of a mother who willingly and who does indeed know that she is taking the life of her own child, that prosecution also ought to take place.
Actually, what he said was he would not prosecute any doctor for performing an abortion of an out-of-state patient that came to Indiana. So,
well, he would be wrong for that then.
Okay. Right. So it was just doctors. It didn't have nothing to do with the mother. Didn't have anything to do, just so you could just quote it correctly. Second piece is, you keep bringing up Scripture.
Yes, sir.
You believe in Scripture?
Absolutely. I'm a pastor.
So let me ask you, I know you do, Pastor, but you know, Scripture has a way of evolving over time. And,
not if you interpret it correctly.
Right.
That is not true, sir.
Okay, so do we still stone people?
No, we do not.
Do we still burn witches for their infidelity?
Infidelity, sir?
If you read the Old Testament, there were not infidels, for their witchcraft. Do we still burn them at the stake?
I don't have the time to go through an extensive discourse on the differences between ceremonial, moral, and judicial law this afternoon.
Well, you brought up the Bible,
yes.
And I just want you to understand that I was told that because I don't believe the same thing you believe about the Bible, that I was a sinful person. And here's the problem I have with that. There are certain parts of the Bible, sir, Pastor, that you know would not exist today. We don't go out and stone people for committing crimes. Do we?
Capital punishment is authorized in some cases in Scripture.
Do we stone people for committing crimes in this country?
No, we do not.
Thank you. As a matter of fact, we actually say in this country that when they do it in other countries, it is evil.
Yeah.
Don't we? We don't castrate women like they do in other countries, do we?
No.
Okay. And so there are a lot of things that were done in biblical days that we don't do today.
My point is the standard of what is right and wrong comes from God himself.
And I agree.
That is the standard against which we must measure any and every law from any and every nation throughout the entire history of mankind, sir.
Okay. Now I'm going to just ask you a question, sir.
Yes, sir.
Because we both are passionate about our God, as you can see. And see, I have a different perspective because this country was built because people were escaping persecution for not believing in the same God and interpreting it the same way. Do you know that that's the history of this country?
I know the history of the country well enough to know that the first people that came to this land from England, the Puritans, who became later known as the Pilgrims, were indeed fleeing religious persecution, yes.
Oh, I thought you were saying the first ones to come to, there were actually people here before they got here.
From Europe, I'm aware of that.
Oh, okay, I just wanted to make sure you understood that. And so those people had a God too, that were here before those pilgrims came.
Okay.
Where's their religion?
The one true God rules over all.
Okay.
There's this thing called evangelism. Evangelists spoke here this afternoon to share the one true gospel of Jesus Christ to those who've not heard yet, so that they too may come to know the one true God and have true eternal life.
Okay. So all I'm saying to you, do you think it's a dangerous precedent when you stand up here as someone who's being a Christian and say that there's only one way to think that the law should be written? It should only be written from one religious perspective.
On the contrary, I think it's dangerous not to think it that way, sir. Because here's the reason why.
Okay.
There's neutrality, which I think is something that most people who have asked questions, contesting some things that some of the Christians and pastors have come up here today. Neutrality is the theme that they're going by. To suggest that because there are other religions and other beliefs that exist in this land, then we cannot have rules from one particular set of beliefs codified into law. That is the general consensus, I think, that I've heard today. Hogwash. Neutrality is a myth, sir. It has been said that we cannot legislate morality. Every time someone legislates something, sir, morality is legislated. Whatever the belief a person has, that is done. That's what gets put into law, whatever belief that person had who wrote the law in the first place, or who amended it, or voted on it, or whatever. Neutrality is a myth. The question is, are we going to say that we're going to bow the knee to the one true God standard and how we ought to rule, or are we going to allow government to become God in and of itself? Because a government that does not hold itself to a higher standard of God, eliminating that from its level of accountability, therefore says, I can say whatever I want, do whatever I want, pass whatever law I want, without accountability. We see where that has gone in the history of the world. Back in the 20th century, how many tens of millions of people died under communist regimes by their own governments because they established themselves as gods effectively with no higher authority to which they could be held accountable? You claim Christ, as do I. We talk about to love our neighbor as ourselves. The higher commandment than that is to love the Lord our God with all of our heart, soul, mind, and strength. And what did Jesus tell us in John 14? What does it mean to love God? He said, if you love me, you will keep my commandments. We cannot define love accurately without using the Word of God to define it. Jesus said, the second greatest commandment, love your neighbor as yourself. He explains part of what that means. And we have to use all of Scripture in order to come to the right conclusion. We can't just pick and choose.
Well, here's the problem that I have. I totally agree with you. I read Scripture just like you actually read the same Scripture. The only problem I have with that is it sounds like what the pilgrims that you claim came over here to escape the religious persecution are now trying to do the same things to the Jews, the Muslims, and everybody. Jews don't believe in Jesus.
Okay.
So you want...
No one can force anyone to believe in Jesus. That's impossible.
Hold on. You want us to... You want to have one religion dictate the morality of this country. And I'm telling you, sir, that's a dangerous proposition. Because one day, you might not outnumber the number of Jews in this country. One day, you might not outnumber the number of Muslims in this country. One day, you may not outnumber the number of minorities in this country. And that day is the day that your religious ideology gets dangerous.
Senator, minorities or not is really quite irrelevant. There are a great many people of Christians of all various shades of skin tones all over the world who will testify that Jesus Christ is Lord. I'm not concerned about that in the least. But I will say this. I have complete confidence in the truthfulness and the rightness and the justice of God himself and the standards by which he has given us to measure all.
Let me tell you why it's dangerous, why I said brought up the race of people. Because the same book you're asking this country to love and to have the morality was used to enslave people by people who manipulated that book.
You're right.
That's the reason why I brought out the numbers.
I think you appreciate you explaining that.
And I'm just telling you, out of love, very dangerous for us to have one religion guide our morality. And I don't want to get into a philosophical discussion with you.
That's fine.
It's something that I have struggled with, including this very issue into the religious thing, into this issue. This is about women and their rights, sir. This is not about religion.
On the contrary.
I'm sorry, not for me. I love you as my brother, as a Christian. I love and I want you to repent, and I want you to see heaven. But I am not going to tell a woman what to do with her body. That is not, I don't have to go to heaven and answer for her. She does. I will tell her, honey, you don't need to do this, like I had to do my 16-year-old sister who was statutorily raped in Indiana. And she was under the age of consent, had her first child, had her second child by the time she was 17, had her third child by the time she was 19. All had discussions of abortion, adoption, other things. That is my sister. She has to answer for that. I helped her, I counseled her. That's what we should be doing, sir. That's all I'm saying to you, okay? None of my nieces deserve not to be here, and they are all here. And God has blessed them to be here. And I'm glad you're here, but please, it's dangerous when we talk about compelling the law under religious authority.
If I may.
Yeah, you can.
The dangerous thing that you mentioned, sir, was the word manipulate. Anything can be manipulated for nefarious purposes. There is a right and wrong way to understand everything, to include the conversation we've just had. The intention of your words, that's what they mean. The intention of my words, that's what they mean. The intention of God's words, that's what it means. And if we analyze it carefully, grammatically, historically, lexically, etc., that's the right conclusion to come to, and that's the meaning that we have to go with. People can try to take things out of context and abuse them. People have been doing it with any kind of text throughout the history of mankind. But my point is also, as related to this, we'd like to talk about the issue of the separation of church and state. I affirm that doctrine. That doctrine was given to people by Christians, I might add, because we believe the state, the civil authority, has a role. The church has a role. The family has a role. And we ought not tread on one another's roles. God has given things for us to do. One of the primary roles of the civil authority is to punish that which is wicked. And by what standard should we measure that which is wicked? We can't, any law that is passed is going to tell people what to do with their bodies in one way or another. There are seatbelt laws telling me that I need to wear a seatbelt when I'm driving a car. Okay, so I wear a seatbelt when I'm driving a car, or whether I get into an accident or not, I'm going to be fined if somebody gives me a ticket for it. So I put a seatbelt on for multiple reasons. The point is something righteous or not? Is that really the standard? Yes, it is. And where do we get the standard for righteousness? We get it from God's word. It's the reason we have laws against murdering and stealing and other things. We know those things to be wrong because each of us is a creature in the image of God anyway. That's why our law should reflect it. And I urge you, senators, please take that into account above all others. Our Indiana Constitution starts out by thanking the one true God that we had the privilege to form our state in the first place. Respect his law. Thank you.
Senator Milton.
Sir.
Thank you, Mr. Chair. Neither you or I or anyone in this chamber have a heaven or hell to put anyone in. God is a sovereign God. We've acknowledged that.
Yes.
He will be the one that we stand before that will judge all of our actions and behavior.
Correct.
Senator Taylor mentioned something, and he took the words right out of my mouth. And when he mentioned the slavery aspect, and I think that we got to talk about it because it came up, right?
Sure.
And I think it's about not manipulation, not just manipulation, but we have to be careful on how we interpret and how we teach and how we personally interpret Scripture.
Of course.
So when you talk about slavery, the interpretation that was used was manipulation at that time. And it was in Ephesians 6:5-8.
With regard to Paul's instructions for slaves.
Slaves, obey your earthly masters with respect and fear, with sincerity and heart, just as you would obey Christ. Now, I'm just going to stop right there.
Sure.
Because if you're being taught something and you're being told you're going to be damned or sent to hell because you're not obeying something that's being projected on you, then you're going to have a fear. So I think the way some folks have come before us with their interpretations of Scripture, right or wrong, because we all have our opinions. Indiana is not a monolith when it comes down to religion.
I understand that.
The United States is not that as well. So we have to be respectful of an individual's personal rights and their decisions, and they will be able to answer to their Creator at the end.
Thank you very much.
Thank you.
Appreciate your testimony. The last witness for the evening will be Jennifer Crossley. Ms. Crossley, want to come up?
I'm going to bring that way down because I'm very short, but I'm also very mighty, so here we go. All right. Good afternoon. Thank you all for allowing us to be here. My name is Jennifer Crossley, and I currently reside in the great city of Bloomington, Indiana. I thank my representative, Senator Shelley Yoder, for inviting me here today to testify against this bill, which is surely banning all abortions, whether you like to admit it or not. To give you some background of myself, I was originally born and raised in Gary, Indiana, and I grew up in church, as my family is from the South and I was raised Baptist, so we were in church at least several different times during the week. Growing up in the 90s, I remember seeing a lot of things about abortion, and I saw abortion clinics being bombed on television. I remember asking at a young age what that all was about, and I just remember that my family just explained to me that we are not for abortion and we are very pro-life. So I grew up for most of my adolescent life well into my teenage years that abortion was wrong, and that's something that I would never, ever do. I judged other women and girls that I knew had abortion, some that were friends, and I turned my nose up to those girls because I knew that they were wrong, but little did I know what life had coming for me. Once I graduated from high school, I attended IU Bloomington in 2001, and I eventually graduated from IU in 2005 and became serious with my college boyfriend. And in 2006, just a few months after that boyfriend graduated, I discovered I was pregnant and scared to death of what my family would think of me. Planned Parenthood, which was my source of health care because I had no insurance, was there for me to get a checkup to see how far along I was. Turned out I was 8 weeks pregnant. As I sat there crying in my office, I told the nurse told me my options. And again, me having that strong conviction that abortion was wrong, I decided at that moment, which was my choice, that I would continue with my pregnancy. So the dream of me going to grad school was just a dream, and I had to wait. And I ended up taking a job as an assistant manager at a clothing store, and that boyfriend of mine ended up taking an assistant job at a camera store. And during that time, we could no longer afford the rent to our apartment because rent is high and it's still too damn high. Because we barely made ends meet, we found ourselves evicted from our apartment, all the while being 6 months pregnant. Eventually, we found another apartment that would take us in April 2007, just one day before my birthday. I had a beautiful baby girl. After having our daughter, I went back on birth control, and we wanted to make sure that we were very careful because we knew that we were not ready to bring another life into this world. And we were trying to chase that American dream that everybody keeps talking about, you know, the one that says if you just pull yourself up by the bootstraps, and I really would like to finish, so I will go ahead and finish here.
Please do.
Thank you. I found out in December of 2007 that I was pregnant again. Having this conversation with my boyfriend, we decided that, again, the times were different. I couldn't have a child, 2 children under the age of 1. In daycare. So I knew that it was time for me to make that choice to have an abortion. And I had a supportive boyfriend at the time. For years, I suffered in silence because I never told anybody my story because if people of my faith would judge me, my own family would even judge me. And some of them that are watching right now are really just discovering that this happened to me because I'm 39 years old. I never had a chance to tell them. So if you're watching now, hi, family. I no longer feel ashamed, and I'm living my best life, and I don't regret that abortion. My boyfriend of mine that I talked about throughout this testimony is now my husband, who is an Emmy Award winner. We have 3 amazing children that one day will change this world, and I hope to God the state for the better. We also have better jobs, and I also sit on my Monroe County Council, and I'm running for re-election. So, as I wrap up here, I'd like to just say that everybody in this single room, whether you'd like to admit it or not, are pro-choice, because that is a choice that you are making. A choice to continue a pregnancy, a choice to terminate a pregnancy, a choice to continue to adopt. That is your choice. That's the fact. I vehemently oppose this bill because it strips away the choices of those who might have to choose. There are women that I know that were sexually assaulted and never went to the authorities because of fear, or because their attackers said that they would do further harm if they were told. The right to choose should be left up to those who have to make the choice to choose, and we have no right getting into personal matter such as an abortion, a choice and a discussion that should be between the patient and their healthcare provider. How dare some of you sit here and tell us that you want to protect the children that will be born when we have a failing foster care children with thousands that are in, no one coming to save them anytime soon. I like an elected official, would like to urge you all as elected officials to use your time wisely in this special session. Come up with concrete ways to help struggling Hoosiers in a struggling economy, especially the fact that we have a surplus in our budget. Debate spending gas tax because gas is still too damn high. Don't waste your time and the rest of your summer debating a fundamental right that shouldn't be left to anybody in this room. So just like how Indiana likes to make sure that we preserve the right of those who choose to bear arms, protect my daughter's rights, y'all daughter's rights, or any able person that is reproductive, that is able to reproduce and create. And just say no to this bill. Thank you.
Thank you, Ms. Crosley. Does the committee have any questions? Senator Yoder.
Thank you, Mr. Chair, and thank you, Ms. Crossley. I want to just say that your bravery to share such a nuanced story where you had the love and ability and access to make different choices at different stages of your life. And I just want to commend you for coming out of the shadows and talking about it, because so much of this bill and why we don't have sex education in this state, why misogyny is so strong, why we've heard from so many today that shame is so strong and can keep us quiet, and it's meant to keep us quiet. I've heard someone say oppression is the absence of choice. And what you've demonstrated today is you made the choice to shed light and bring out of the shadows and here in this chamber your truth. And I just want to say thank you, and you taught me some things today.
Thank you.
Does the committee have any questions? Ms. Crosley, thank you very much for your time. Thanks for coming to testify. That concludes our time for today, and just so everyone knows, we worked through this list that we had today based on the order in which those came in. I regret, obviously, not having the ability to get everybody that's on the list to come in and testify. We simply will not have time to do all that. As we saw today, I think we had, my guess is about 50 people testify, but it was a opportunity to testify on both sides with ample opportunity for the committee to ask questions. We will do the exact same thing tomorrow. Those of you who are on the list, as I said earlier, you'll be on the list tomorrow. Come back in. We'll need you to check in so that we know you're here, but check in, and then we'll try to continue to move through the list as best we can. And I want to thank everybody for their patience and for their demeanor and their in this committee here this afternoon. I think it was a productive meeting, and I appreciate everybody's efforts. Having said that, we are now in recess until tomorrow, Tuesday, July the 26th at 9 a.m.